Yeah, yeah, exactly. Yeah. When I see two ladies coming up to me around 8:30 or 8:45, and I start seeing walking up the stairs, you know it's
Good morning. We're going to start in about 2 minutes, so 2-minute warning. Grab your coffee, your pastries.
Good morning, friends, colleagues. If we could ask you to please take your seats, we'll be starting in just one moment. And to those online, we will be starting shortly. Thank you for your patience.
Good morning, good afternoon, or good evening, depending on where you're joining from. Welcome to the 6th Annual Global Social Service Workforce Strengthening Symposium. I'm Betsy Sherwood, Director of the Alliance. It's a pleasure to welcome everyone here today in Washington, D.C., as well as everyone joining us on webcast from 42 different countries around the world. We'd like to give an especially warm welcome to those who have organized the 13 watch parties happening in different countries, including Nigeria, Philippines, Somalia, Kenya, Ethiopia, Gabon, India, Russia, Uganda, Zimbabwe, and 3 other places in the United States. We're extremely grateful for the support of GHR Foundation, UNICEF, the National Association for Social Work Management, who have all helped to make today possible. This morning, we're very excited to release our 2018 report, The State of the Social Service Workforce, Trends and Recommendations for Strengthening the Workforce. Throughout today's symposium, we'll learn more about the mapping and assessment process, and we'll dive into the key findings and recommendations. The report also makes connections to our call to action, which we released exactly 1 year ago today at this same event. We continue to see traction and momentum towards the points outlined in the call to action, as evidenced by UNICEF's recently released guidelines on strengthening the social service workforce for child protection, which were developed in collaboration with the Alliance. Just last week, I had the pleasure of visiting Bhutan and working with UNICEF's South Asia child protection teams on the implementation of these guidelines. Their enthusiasm for better understanding, their commitment to planning, developing, and supporting the workforce was truly inspiring. It's motivating to see a growing interest in this topic and also the global expansion of our work. This year, we've taken on creative approaches to engaging new stakeholders. And in just a few weeks, we'll be in Uganda to pilot a media training workshop for members of the social service workforce and local journalists. This exciting initiative is part of work related to promoting the Inspire package, 7 strategies for ending violence against children. It's amazing to think the Alliance was formed only 6 years ago, with the vision of serving as a convener to advance knowledge and advocate for the workforce in local, national, and global levels. We've clearly come a long way since then. This steady progress is due to the hard work and commitment of so many of you who serve as our champions, and understand that the social service workforce is the most important driver of change to ensure access to quality services for all people. Without the workforce, most especially the critical frontline community-based workers, there would be no promotive, preventative, or responsive services available. The social service workforce needs to be adequately resourced and supported in order to effectively work with individuals, families, and communities. And most importantly, members of our workforce play critical roles in addressing the root causes of poverty, working to ensure all human rights are respected, social justice is possible, and we can make positive change occur. Today, we'll be talking about what we've learned in our evidence-gathering process and how it can inform our next steps of workforce strengthening. We'll also hear from 3 speakers who will share their insights on what it takes to mobilize and get commitments for resources to support our work. It's going to be a packed and informative morning where we can reflect on the significant accomplishments we've made this past year. None of this would happen without the dedication of a host of important people, notably the staff of the Alliance, Amy, Nicole, Natia, and Dana, our dedicated consultants, researchers, and partners who teamed with us this past year to support our work in countries around the world, and our 10 current Alliance ambassadors who are serving as workforce champions in their home countries, as well as our outstanding steering committee members who, under the leadership of Rebecca Davis, our chairperson, continue to drive forward the mission and vision of the Alliance. It was truly an honor to be asked to assume the role of director just 6 months ago, and to have the opportunity to build on the outstanding work of Amy Bess, who wholeheartedly led the Alliance for 5.5 years. We're incredibly grateful that Amy's remained on our team as our senior advisor. Can we please have a round of applause for Amy and recognize her outstanding efforts to bring us to this point? Thank you for joining us today.
Great. Thank you, Betsy, and thank you to you as well for all of your work. Good morning. As Betsy said, my name is Nicole Brown. I'm the Deputy Director of the Alliance, a role that I moved into February of this year. And I've actually been with the Alliance for over 4 years. And it's amazing to see the level of engagement and the increase in our work in that time. And I've enjoyed working with and meeting so many of you in this room and who are online today. This year, the Alliance membership grew to more than 2,200 people in 136 countries. Our members come together to exchange promising practices, develop new tools and resources, and advocate for workforce strengthening. Today, we'll talk more about these increasing advocacy efforts. As we began the annual State of the Social Service Workforce Report 4 years ago, it was largely to build the minimally existing evidence base that showed the range of types of social service workers, capture their existing and needed training and education, determine existing ratios of workers to population, capture existing workforce policies, and learn how professional associations are supporting these workers. This year's report continues to build this evidence base, but now we're increasing our focus on the next steps of using this evidence to advocate to government and other key stakeholder groups for commitments toward greater planning, development, and support to this frontline workforce. We hope today's symposium will serve to inspire, embolden, and educate you on how you, your organizations, and your networks can all work together to achieve greater support. Our webinars, Social Service Workforce Week, Child and Youth Care Worker Week, which is happening this week, our open resource library, interest group on advocacy are all additional ways that you can become involved, learn more, and exchange innovative ideas with your global colleagues. We hope this 6th annual symposium will only be the beginning of a desire to become more engaged. And for any of you who are not yet a member, online or in this room, we invite you to join the Alliance and help build this network of supporters and advocates. We hope that you'll enjoy today's event. We've left time after each panel for discussion and questions. For those joining online, we hope that you can note your questions in the chat field of the page where you're viewing this webcast, and these questions will then be relayed to the presenters as time allows. We also encourage your comments, your questions, your reactions on Twitter using today's hashtag of SSW Symposium. And finally, we'll have a chance for some interactive discussion during our coffee break and our participatory activity this afternoon, where we'll work together to develop key messages on supporting the social service workforce. Your work toward developing these messages will serve to strengthen our advocacy efforts and support both the Alliance and the advocacy interest group, but also your own individual efforts. Your program provides bios for each speaker, so the moderators will only be providing brief introductory bios and remarks. And to those viewing online, the program can be found on the webpage of the symposium page of our website. So with that, I'm now happy to introduce our keynote speaker today, who we're so happy could join us from UNICEF. Mr. Ted Chibin was appointed Director of Programs for UNICEF in August of 2014. Currently based at UNICEF's headquarters in New York, he has held a number of national and regional positions during his 22 years with UNICEF, including leading humanitarian, emergency, disaster, conflict, health, ECD, social protection, food security, and child survival programs, and I'm sure many more. In all of these large-scale efforts, he has witnessed, supported, and worked alongside social service workers to deliver timely, effective, and efficient programs. We're also appreciative he's joining us today some of UNICEF's current strategic priorities and future plans towards supporting this frontline workforce to protect children, families, and communities. And we're so excited to call him an advocate and ambassador of the social service workforce and really ally for championing this workforce. So now, please join me in welcoming Mr. Chibin.
Good morning, colleagues, and thanks to Betsy and to Nicole. On behalf of UNICEF, I'm truly honored to have been invited to address the 6th Annual Social Service Workforce Strengthening Symposium. This is an area that I've been passionate about, as Nicole said, for a long time, and I'm really glad to be here. I'd like to thank the Global Social Service Workforce Alliance and all of you present here today for giving me this opportunity to contribute to the conversation on how we can further strengthen the social service workforce in all countries and regions to better protect all children from violence, abuse, neglect, and exploitation. We all know, I know we're preaching to the converted here, that social service workers, government and non-governmental professionals and paraprofessionals working across sectors are often the first line of response for children and their families. They are the most important element of a well-functioning child protection system. And yet, as Betsy said, we often know that they're also under-resourced. They're under-supported. So their ability to be able to do their work, to perform their work, requires proper political, human, and financial support. Our experience in UNICEF globally in supporting child protection systems and their strengthening has demonstrated that a strong social service workforce linking actors across sectors plays a central role in identifying, preventing, and managing risks and responding to situations of vulnerability and harm. It also plays a key role, and I think that's an opportunity we need to leverage more, in alleviating poverty by being part of the infrastructure that administers social protection measures. This is an area actually that's getting a lot of attention now, and I think those linkages could be reinforced. It also allows the facilitation of access to and delivery of social services, the promotion of social justice, reducing discrimination, and challenging harmful behaviors and social norms. So investing in the social service workforce yields high returns for children and their families. On the other hand, lack of investment in the social service workforce undermines other efforts to strengthen child protection systems in a sustainable manner, including enforcement and implementation of policies and laws, operability and effectiveness of case management systems and service delivery. So recognizing the fundamental role of social service workforce in the lives of children and families, we've identified in UNICEF social service workforce strengthening as a strategic priority for our work to protect all children from violence and exploitation and to achieve the SDG goals and targets to end all violence against children. In fact, I can say that I've been one of the people who was instrumental in the establishment of the global partnership to end violence against children. And when I was in the field, when I was working in Ethiopia, when I was working in Sudan, when I was working in Sri Lanka, I wanted a partnership, an alliance like yours, to help strengthen that system. And one of the key reasons for establishing that partnership for our involvement with the Alliance is very much to focus on this. We've got a very ambitious global development agenda, as you know, through the Sustainable Development Goals. And we've estimated that 65% of the 169 targets of the 17 SDGs will not be reached if we don't engage and coordinate with local regional authorities responsible for social services, and the social service workforce is a key part of that connection. So to support these efforts, UNICEF has just released new guidelines to strengthen the social service workforce for child protection. The guidelines were developed, as Betsy said, in close consultation with the Alliance, and they were informed by the evidence of what works and of lessons in the field. They aim to accelerate and support regional and national efforts to plan, develop, and support the social service workforce, including guidance on how to provide promotive, protective, and responsive services to vulnerable children and families. I think the increased investment that we're all making in this sector is already showing results. 132 countries, according to what we've gathered as information last year in UNICEF, across all regions invested in workforce strengthening. And that compares to 114 in 2017, so an increase. These countries are reporting progress on strengthening the legal framework for the social service workforce, establishing high-level leadership and coordination structures to advance this agenda, creating supervision and support mechanism, and strengthening the capacities and education of the workforce. Let me give a few examples to illustrate what I mean. So in Nigeria, which is a key country in the west of Africa, the government has set up a multi-sectoral steering committee and adopted a roadmap for the implementation of its national social welfare workforce strategy. Recognizing the dearth of social workers, 315 local government social welfare officers, or SWOs, were trained on child protection and case management using the harmonized in-service training manual for social workers and auxiliary social workers. Vietnam has invested in social work education to enhance the qualification and skills of its social service workforce. The Hanoi National University of Education complemented its Bachelor of Social Work with 6 additional modules on child protection. Turning to Mexico, Mexico is diversifying and expanding the skills of its social service workforce to adapt to the evolving and changing realities on the ground and to meet the needs of an ever-growing number of migrant children. I visited Mexico at the beginning of the year and was able to see this work in action. These workers from the Child Protection Authority now have the capacities to undertake best interest assessments of migrant children and to develop care plans for these children. And lastly, in Burundi, the government has increased its supervision and support to community-based child protection committees who are in direct contact with children and their families. More than 17,000 members of these committees have been trained and supported by government social workers through regular follow-up and trainings. I think what's nice about these examples is it illustrates the range of social workers and social work workforce that we're looking at. This year's symposium, focusing on evidence for action and sharing of promising practices from various regional and country contexts, is key. Generating such evidence and data is important to better understand the social service workforce and its role in child protection, the work they do on a daily basis. Collecting and analyzing data is also essential for generating evidence needed for advocacy and bringing greater visibility and investment to this area of work at country, regional, and global level. So to generate this evidence, from a UNICEF perspective, we've partnered with the Alliance since 2017 to support workforce mapping and analysis in 32 countries in 3 regions. The first of these regions was in South Asia, where the UNICEF Regional Office for South Asia published the State of Social Service Workforce in South Asia with findings from 8 countries in that region. For UNICEF, there are 8 countries: Afghanistan, India, Bangladesh, all the way to Bhutan. The findings are now informing national plans of action in each of these 8 countries. And there are similar mapping exercises underway in the Middle East and North Africa, as well as the East Asia and the Pacific, so an additional 24 countries covered. I think beyond the work that we've done with the Alliance, there's also been mappings done in Europe and Central Asia, as well as in Latin America and the Caribbean. This last region will publish its results this year. So I think this mapping really gives us a sense of who's out there, who's doing what kind of support is further needed. And I think it's kind of exciting that this is now covering pretty much every region around the world and can be used for further engagement. And in fact, the key findings, trends, and recommendation from these country mappings are included in the 2018 State of the Social Service Workforce Report released today by the Alliance, and they will be further highlighted and shared in today's discussions and presentation as a catalyst for greater planning, development, and support to the social service workforce. Colleagues, one of the key findings from that evidence collected to date across all regions is that countries are finding it difficult to define who should be considered part of the social service workforce and who they should count. So that's the first of the findings that comes out. The diversity of workers who constitute the social service workforce for child protection and the multitude of functions they perform often makes it challenging to determine who is and who is not part of the workforce, as opposed to allied professionals such as teachers and health workers who also work in the social service sector. I have this discussion with a lot of the partners at the Global Partnership to End Violence Against Children, and they make the point that to address violence against children, you need to work multi-sectorally, we need to work in health, we need to work in education, we need to work across the board, and I fully agree with that. But I also make the point that if the core system of social service workforce is not in place, this core system of child protection is not in place, the rest of it won't work. So you need that in place at the core. In defining the scope and who should be part of the social service workforce, countries have different views of who should be recognized. In some countries, especially high and middle income countries, their aim is to have a highly professionalized workforce where social workers play a key role. In other countries where the social work profession is still very much in its starting stages, governments are also eager to expand the social work profession. These countries recognize a valuable role and contribution that paraprofessional and community-based workers play in child protection. I think the examples I gave, for example, of Burundi, is one such context. But regardless of the path that countries choose for strengthening the social service workforce, identifying who is part of the social service workforce and reaching consensus at national level, it's critical to define that scope and range so that the strengthening strategies that are needed to plan, develop, and support this workforce at country level is tailored to their needs. So that's the first finding. Let me now turn to the second finding. Few countries have legislations or policies that specifically define the social service workforce. Country task groups, national leadership groups, or other representative stakeholder groups can facilitate the development of this definition. There are also issues with the estimates of workforce size and competition, which often rely on data of government workers alone. So only government workers are captured. And this may not accurately reflect workers engaged at the community level or by non-governmental entities. So where possible, investment in adapting and using HRIS for the government and non-governmental social service workforce should be explored. We need to make efforts to ensure that NGO and other non-governmental entities involved in social service workers are engaged in the mapping process at the national level in collaboration with government, and that they understand the benefits of being part of that process. As you know, education and training opportunities are available, varied, growing, the example of Vietnam that I gave, but still limited. Field placements in short-term and certification programs, especially for paraprofessionals and community-based workers, are still limited. Capacity building options for the social service workforce should include diverse educational and training programs adapted to the specific tasks and functions they perform in child protection. So for example, a community-based worker will need regular, flexible, and short training and certification opportunities throughout the year to identify and refer cases to appropriate social services. On the other hand, workers who are involved in complex cases requiring intensive psychosocial support and counseling or a best interest determination will require advanced long-term training. So to have programs that are tailored to the need of the individual. I think another important point, and I saw this in my work in Ethiopia, is that most workers report having a supervisor, but they're less satisfied with the quality of the supervision that they're getting. So guidance on supervision, clarifying its educational, administrative, and supportive function, I love that word, supportive functions, should be prioritized, particularly as governments or regulatory bodies seek to set standards or strengthen current practice. And lastly, in terms of this bucket of issues, professional associations are widespread, but their capacity is often limited by lack of formal or legal recognition and a narrow view of who they represent. So back to this issue of definition. Formal recognition by governments or professional associations and their roles, either through legislation or other formal means, is important for legitimizing and enabling them to contribute to the workforce strengthening process. So, colleagues, these findings call for a more concerted effort to support country capacities to develop and strengthen the workforce. In 2019 and beyond, UNICEF looks forward to continuing its long-standing partnership with the GSSWA, with governments, with civil society, and partners across all regions to support ongoing efforts to strengthen the workforce. These efforts require strong national leadership and ownership, which we should all support, but please do count on us as a key partner. We really look forward to continuing to work together to develop and disseminate additional tools and resources to complement the new guidelines that I mentioned, that we just released, and to help countries to contextualize and adapt these guidelines to their own realities. I think that's the key part of the work, is the operationalization. Another resource that I want to mention, which was part of this mapping process, is the Social Service Workforce Mapping Toolkit. I hear from the colleagues that this is such an extensive toolkit that it's down to like agendas for meetings and draft minutes. You can have everything you need there. It's all ready-made to get going on any kind of mapping process. So that's kind of exciting when it gets to that level of specificity. So this is just released, and it was, again, developed on the experience of these regional-led mapping exercises that I discussed. Turning to countries, and I know that several of you are here in an individual capacity, but you come from countries where these issues are critically important, and this is clearly, frankly, a universal issue, which is important to all countries. So in fact, we do encourage all countries across all regions to undertake similar mapping exercises. So if there's places where this mapping has not taken place, it is an important first step to finding out what are the gaps to strengthening the workforce. And specifically to determining what's the right number of workers with the right skills and capacities to perform their functions at the right places, at the right time, to provide effective support for children and their families. And as part of the efforts, we really call on countries to intensify investments in workforce education and skill development. There's so many experiences in the room, so many people working on these issues that I hope you can cross-reference and see what you can do to strengthen that. We really call on countries to develop capacity development frameworks for strengthening the social service workforce and child protection, to ensure that the workforce is performing their functions with quality. While you can use training packages from other countries, it is very important that these capacity building efforts are adapted to the national context and reality, and that they meet the need of the social service workforce as defined through the country mapping exercise. And finally, I think this is work that's underway. It would be important to recommend the ratio of social service workers to the child population. One of my big loves in my career has been the work that we've been able to do in primary health care, which generated the child survival revolution. And most successful health systems that have contributed to that child survival revolutions have decentralized their services and have had a point of contact at community level between the family, the community, and the health system. So typically you'd have a community health worker for every 5,000 people. So what's the equivalent for the social service workforce, and what are the recommendations? And again, it's not going to be a cookie cutter approach decided globally, but it'll be an opportunity to have a range of parameters and indicators that can be used. So, colleagues, our commitment to protect all children from violence and exploitation and to strengthen child protection systems can't be realized without this strong social service workforce at country level. I know that we all recognize this as an important element of any child protection system, and that that system can't work without people who day in, day out focus on the most vulnerable, are there to support their families and the communities in which they live. I know that we're convinced that this is needed, and I hope that we can continue to work together so that we can support this workforce and we can make it happen in more places where it's not a reality. Thank you.
So, good morning to everybody. Welcome to the 6th Global Symposium of the Social Service Workforce Alliance. I am really truly delighted to be chairing the first panel session this morning, which will be focusing on building the evidence base to support the social service workforce and its development. I am also truly pleased to welcome a whole set of panelists and speakers to today's event. And these speakers will be sharing with us today some of the lessons learned from UNICEF's and the Global Social Service Alliance's led mappings and assessments across the different regions and in different countries. And of course, we know how important these assessments have been in generating very valuable evidence to understand what the state of the social service workforce is in these countries, but also really trying to give more visibility to these issues as these states and governments go through these processes, and to create more ownership and leadership by government and civil society to drive these processes forward at the country and regional level. So without further ado, I would really like to start by welcoming the speakers on today's panel. And I would like to give the floor, first of all, to Dr. Natia Partzka-Halze, who is the Senior Technical Advisor working with the Global Social Service Workforce Alliance. And Natya joined the Alliance as Senior Technical Advisor in 2017, but she's not new to the Alliance. She was previously a steering committee member for 3 years on the Alliance. And she brings over 19 years of experience in the field of child protection, social work, and social service workforce strengthening. So without further ado, I would like to give the floor now to Natya for her presentation, which will focus on giving us an overview of the methodology and the process that was followed by most countries in mapping, in their mapping exercise of the social service workforce, with a particular focus on what we have accomplished in East Asia and Pacific and in the Middle East and North Africa regions. So Natya, over to you. Thank you.
Thank you, Kirsten, for this great introduction, and thank you for the great presentation, Mr. Chabon. It was all-encompassing, and we don't have much to say because you've covered it all. It's a great pleasure for me to be able to present to you our experience of mapping and assessing the social service workforce, and I'm glad that we have many viewers all around the world joining us in this discussion today. The mapping and assessment of the social service workforce is one of the key areas of work for the Global Social Service Alliance, because one of our aims in general is to advance the knowledge in the field, and mapping and assessment that we are supporting now in so many countries is one of the main sources of the knowledge which we know that is mostly lacking in many countries. The evidence in the field is one of the key issues. So we're pleased to be able to contribute to this knowledge, to be able to produce the tools and disseminate the reports which will be informing the work in the field in so many countries in the world. One of the areas of work which is helping us in advancing the knowledge in the field is also the interest groups that we are supporting, and the latest interest groups that we have are interest groups on advocacy and case management, and many of you are probably the members of this group, and we invite others to join us as well in this group. We're trying to disseminate the current knowledge in the field to the members of the Alliance and also individuals who are on our mailing lists through e-updates and blogs, and we are hoping that this knowledge is helping you in your daily work. One of the functions of the Alliance is also to convene and connect the interested individuals and organizations who are working in this field. And this symposium, and you know it's the 6th one in the row, is one of the ways how we are trying to support this work. And also our aim is to help all of you in advocating for strengthening the social service workforce and to do this work on our own. And the call to action that we've produced last year is one of the ways how we're trying to achieve this goal. And on the slide you also see a few reports that we've produced in addition to the report that we're launching today, which hopefully are providing you with enough knowledge in the field. Now more specifically about the mapping of the social service workforce. The aim for the mapping is really to facilitate deep reflection and understanding of the current status of the social service workforce in the countries covered with the mapping, because without the knowledge of the current situation of the workforce in the countries, it's close to impossible to properly plan, develop and support the workforce, because we need to have up-to-date knowledge and we know that the information management systems in the countries are not there and don't always contain enough information to be able to do this proper planning. The information which is produced through the mapping is important for the decision makers, but also for the practitioners, academicians, also representatives of the professional associations, because they also plan their work around the findings of the mapping. And we really hope that the representatives of the countries are able to use these findings for better advocating for their cause, and also for developing the policies, strategies, and programs which are better informed with the current knowledge about the workforce in their countries. The mapping provides evidence, baseline information for the indicators which are key for strengthening the social service work. And these are some of the areas where we are able to collect information through these mappings. One of the areas is planning, and we are assessing and reviewing relevant policies and regulations, also all available reports and documents in the countries to be able to see what is the state of the social service workforce in the country. These desk reviews are very important in order to understand what has already happened in the country, because of course the knowledge of the current situation is an important basis for planning any additional work. Also, through this exercise, we are able to define the number of social service workers in the country and know what is the ratio of the social service workforce per 100,000 child population. This is the indicator which is not always very important to identify, and Mr. Chabon has already talked about that, but we're aiming to define the number to include the representatives of the governmental and non-governmental workforce, because they are equally important in contributing to providing social services to children, families, and other members of the communities. Another important area where we're collecting information is on development and training, and you would all agree that it's important for the countries to know what educational opportunities are available in the country for the professional and paraprofessional workforce representatives, for the volunteers, for them to be able to gain needed knowledge for providing quality services to children and families. And many countries are really advancing their systems by developing academic programs in social work and other related fields, as well as other in-service or continuing education programs, and we are trying to identify exhaustive information about this through the mappings. Also, the part of the mapping is to collect information on the size, role of the workforce and the role of the associations, which was mentioned to be very important in the countries as they are supporting the workforce in advancing their roles. These are some of the strategic plan output indicators which are used by UNICEF, and I will not go into details on this, but it's important to say that these indicators will very much guide and help the countries throughout the world in planning their work. And the mapping and assessment that we're talking about is contributing towards collecting data on these indicators. On this map, you see the countries where we've supported mapping and assessment of the social service workforce, and it was also mentioned by the previous presenter. I will not go through the list of these 32 countries. However, if you have any specific questions about those, I'll be happy to answer those. And we're glad to see that the mapping has covered pretty much many regions in the world. The mapping is a long process, and what's very important in this process is to make sure that it's led by the national leadership group. And by saying that, we are not suggesting that the countries establish these groups. Some of them might have similar groups already in place, but it's important that the process is led by the key stakeholders in the country, because first of all, they are the ones who have the knowledge about the workforce in that country, and also they are in the position to use these findings for future planning, for advocating for the social service workforce, and so their involvement is the key in this process. And here on the slide, you see a number of steps that we had to go through during this mapping process. Also what is important that at the end of the mapping, we are trying to validate all these findings with the representatives of the government and key stakeholders in order to be sure that we are all in the agreement on the findings and recommendations produced through this process. This slide shows you the methodology used for mapping the social service workforce in different parts of the world. It provides information about 4 regions, one of them being Europe and Central Asia, where the mapping was not supported by the Alliance. But in the rest of the countries, we supported the desk review that I have already mentioned about, and which is a very detailed process of reviewing all the legislation, policies, and reports already available in the country. We're making sure that we're reviewing documents available not only in English but also in native languages to be able to collect full information. And also we have 2 tools which are used in those countries. One is the tool which is collecting administrative information from the key agencies, being these government entities, academic institutions, professional associations, or any others. And the other tool that we're using is a worker survey, which looks into the perceptions of the workers about their own conditions, about the supervision experience, the level of their knowledge, and so on. And if you'll have questions, of course, I'll be happy to tell you more about these tools. These are some of the key considerations for the mapping and assessment of the social service workforce. And again, in the last, as a last bullet point, you see the same point that we're trying to make every time. It's important that this process is led by the national leadership group and is participatory, because otherwise the process is not able to capture all the developments in the countries which are so important to know. Because if we don't have this process run as a participatory process, it's close to impossible to ensure the ownership of the findings and hence proper use of this information for future planning and development. Another very important aspect in this mapping is to agree on the definition used during the assessment. And this slide shows that in the regions that we've covered with this mapping, there were 127 unique titles used for social service workforce, which were identified only in South Asia. So it's important that before starting the mapping and assessment process, we agree on the definition of the social service workforce. And we all know the global definition tailored by the Alliance with the involvement of all of you and all important stakeholders. And also to look into the global definition of social workers, because we all know that the term social worker is often used to describe other members of the Social Service Workforce Alliance. And it was also mentioned by the previous presenter that defining allied workers is an important part of this process, because they are important, but we don't want them to be included and counted as representatives of the social service workforce. Limitations of the process, and there were many, because the mapping which was supported by the Alliance this time was regional mapping, and we were working in the regions where the scale of the countries was like drastically and very different from each other. So comparing findings in China or in any other country in the world is difficult, and it's also making some constraints in developing statistically significant matching samples. Also, very importantly, we've said that definitions used by the countries are very different, and so it makes it different to have regional comparison. Data collection is often an issue, and in some countries we were able to do data collection via online surveys, but in other countries where the access of workforce representatives to internet was very limited, we were trying to make sure that the data collection was done through paper copies, and it was further complicating the process, but was really very important to have. And one last point that I want to make, in your efforts to plan for the mapping process in the country, it's important to make sure that all the participants of the process agree on the terminology and concepts used during the process. Because during the mapping in many parts of the world, we've realized that these concepts are not used similarly and not understood similarly. And some of those examples are professional supervision and code of ethics, which we've found out that not every country and not every professional or decision maker is understanding in the similar way. So this is very briefly about the process and the methodology, and as I said, we'll be happy to respond to your questions, but I want to say that this is the work in progress. We are also learning through this process, and we are trying to include our learning in the toolkits that we're producing, and which we hope will be helpful for the countries in their future efforts. Thank you.
Develop and strengthen the social service workforce. So over to Aaron, who I believe will be on video.
Hi, everyone. It's great to be here with you. I'm sorry I couldn't be there in person, but I wish you all a successful conference. And I'm happy to be able to present today the Social Service Workforce Strengthening Initiative in Europe and Central Asia region. I think it's important to start with a contextual difference for this region. As many of you know, there's a legacy of large state-run institutional care and strong justice systems that have been reformed over the past 20 years. And those reforms have led to a growth in social services, alternative care services, and the demand for professionals, both social workers, foster caregivers, youth workers, both in the justice system and the social welfare systems across the region. And so based on that history, we tried to make an effort to further understand this area and co-create a framework with governments for measuring and advancing and identifying the bottlenecks of the social service workforce in this region. So the situation across many countries of the ECHA region, which we did a mapping prior to a large conference in November in Bucharest, Romania, with many governments, found that staff in positions that require social work competencies tend to lack a social work professional education. So many people in positions, most of them within government, with social work requirements that don't have the competencies. This despite the fact that the region, every country in the region, now even Turkmenistan, which is the final country to adopt a social work program, has a social work degree course and is refining these courses. So a major disconnect happening in the region. Ad hoc provision of in-service training for social workers and the larger social service workforce, low pay, low status, high caseloads, poor working conditions, weak professional technical supervision. So a range and a litany of things that also are outside of competencies and have to do with the environment in which the social workers are and other social service workforce professionals are working in. We also found low levels of trust in social service workers, a lack of data about the workforce, and a lack of common definitions across countries, which led us to the conclusion to try and develop a common framework, and very little preventative and promotive social work, and much more a case management approach rather than a social transformation approach to social work. So we developed a regional call to action and monitoring framework and convened this conference. And the goal of the regional call to action and the monitoring framework is to really promote the fact that functions and competencies and qualifications are aligned across the social service workforce, that only qualified professionals should be in roles requiring professional competencies, and that governments, along with many partners, academic partners, training institute partners, NGOs and others, really need to map that out. What are the professions that require professional competencies and which one perhaps don't require professional competencies and really are part of the stratified workforce that include a range of personnel deployed across a range of services, whether you're foster care or guardian or youth care worker or a psychologist without a degree but performing some level of psychosocial support. So really mapping both a stratified workforce at a more broader level, but then also really identifying those who require higher level competencies and functions. And so the ECHA regional categories for monitoring that we've identified that we believe all countries in the region should monitor, and which they've agreed to, is that social workers, one is social workers with university degrees in social work. We want to increase that number in statutory social work decision-making roles. Professional specialists is the second category, and those are people who are employed in social service providing organizations and have professional qualifications other than in social work. So examples include child psychologists, social pedagogues, lawyers, speech therapists, and again, countries need to sort of categorize which types of workers they have in their social service workforce. Some may have speech therapists and some may not, but at this stage. But the idea is that they would really look at those professional specialists that they have in the country and begin to monitor how many and what their professional degrees were. Paraprofessionals would be the third category, employed in social services in roles that do not have a requirement for a specialized formal education. So examples of that would include foster caregivers, personal assistants, home care workers. Number 4 would be the allied workforce in social protection, which is an important category, oftentimes employed by the same ministries that are employing a vast majority of other social service workers. But those in social protection who are allied workforce in social protection would be your social assistants, those who are providing cash grants, involved in employment schemes. And then the 5th category is allied workforce in other sectors, and that would be social service workforce in health and education primarily. And there you would look at ring fencing and looking at which professionals like home-based care nurses or personal assistants in the health categories, which would play a social service function, and really looking at that allied workforce component. The 6th category is an important category for our region because it's the practitioners who are performing social work tasks, and we use that word practitioners, performing social work tasks that require professional competencies in social work, who are employed in statutory social work decision-making positions, and that have no social work degree. We have a large number of this category that we want to push into the first category as social workers with university degrees because of this gap that I mentioned earlier. The next steps and progress in implementing the call to action, it's not just about education and practice, although mapping shows that they need strengthening. It is about the architecture of the system around the workforce. This includes job descriptions, incentives, monitoring, management, regulation, policy environment. These things are absolutely critical in this region to support and promote the workforce. And the UNICEF Regional Office is currently mapping the situation and identifying options to address these constraints and to use these competencies in the workplace for social service and allied workforces and social protection. So we're taking it a bit of a step further now. And countries in the region are now taking forward the call to action. We see a lot of work following this large conference in November of 2018, a regional initiative to improve interpersonal communication skills and community outreach among the social service workforce is going to be tested in Georgia and Kazakhstan by the government. Serbia government is calling for a Western Balkans high-level meeting to exchange experiences around the social service workforce, an intergovernmental meeting at their own making. And the Republic of Georgia plans to create new placements for social workers supported by a state-certified non-degree program under the new law on social work, which is an important development because it's trying to bridge the gap between those who are practitioners performing social work functions with statutory authority who don't have degrees, and try and really upskill those professionals, but then set a cutoff point beyond which those performing statutory social work functions, particularly in the child protection system, would have to have a social work degree. So it's a framework, a legal framework that they've created that is really a model for our region amongst one of the key calls to action. We have a lot more resources where you can find out more. That was a very brief presentation. I wish you a very, very successful conference, and I really hope to see all of you during the year or maybe next year. Bye for now.
Okay.
Thank you very much to Aaron for his presentation and sharing his experience from that particular region. We can come back to that later in our conversations, as there are some unique and specific realities in that region that will be interesting to learn more about and to share experiences from. So next in line, we have two presentations, also video presentations from UNICEF Child Protection Officers and colleagues in Tunisia and Cambodia. I believe first we have the Tunisia presentation, which is by George Abadjan, who is the Child Protection Officer in UNICEF there, and who will be sharing the experience from that particular country context. Coming up shortly. There we are.
So with regard to the question on the mapping process, this was key in gathering Tunisian stakeholders around the table to discuss the opportunities and challenges with regard to the social service workforce. The exchange, both in the meetings to validate questionnaires as well as the initial findings, contributed to the overall learning process. There were lively debates around the definition of social workers, on their capacity, on their motivation and career development, which helped to identify certain important aspects of the social service workforce. The process was also an opportunity for UNICEF to mobilize through joint child protection and social protection efforts key partners at national, regional, and community level, which in itself was a learning process. So with regard to advancing the work, the Tunisian government on several occasions has welcomed the conducting of the study and sees this as a roadmap to strengthen the social service workforce in the country. The study is also very timely, as the UNICEF program has a strong focus on strengthening the child protection and social protection systems to better serve the needs of the most vulnerable children in the country. So concretely speaking, the study will be used to strengthen the social service workforce with short-term and long-term planned activities. UNICEF will advocate in line with the study's recommendations to improve the working conditions of social workers. In the next 2 years, UNICEF, jointly with the Ministry of Social Affairs and other relevant ministries, will work on strengthening the capacity of social service workforce, which has been already included in the government of Tunisia UNICEF biannual action plan. So the major activities will focus on revising the curricula for pre- and in-service training for social workers, including through a more practical approach on child rights in contrast to a more theoretical one. Furthermore, UNICEF will develop training of trainers for an identified number of social workers with government commitment to ensure that this process is sustained, as well as introduce a coaching mechanism to motivate the social workers and foster career development.
Okay, now we're going straight through to the next presentation by Sophia Pock, who is the Child Protection Officer in Cambodia.
The mapping is the first time that Cambodia conducts such comprehensive data collection on social service workforce. And this mapping exercise provides a lot of new knowledge to the Cambodia. And I have learned a lot in terms of the new knowledge. Firstly, the social service workforce is so diverse in this country. Up to 46 different position title has been identified, and the size of the workforce is still very limited. And those who are already in the workforce, they are still lacking of skill, knowledge, and quality supervision that allow them to perform their job well. In addition, the concept of social work is still very complex and confusing, and we don't have any specific law and policy dedicated to social work. The mapping process also provides a good opportunity for all the actors to be together on these subjects, and it is now time to build on this network of actors for further programming or support social work force in this country. The findings from this mapping will be used for several initiatives to further plan, develop, and support the social service workforce in Cambodia. Firstly, the new knowledge from this mapping will include in the business case on social work that is being conducted by the Ministry of Social Affairs. And this business case aims to advocate for an increased government investment in social work. Secondly, the findings from this mapping will be used to inform the capacity development plan, which aims to build capacity of at least 600 social service workers by 2020. And lastly, the finding will serve as a national baseline for planning and programming related to social service workforce and contributing to achieving the SDG targets to prevent and respond to all forms of violence against children.
Okay, thank you very much to our colleagues who presented on videos. We're now moving along to our last speaker for this panel session. We have Alex Collins, who is our lead author for this year's State of the Social Service Workforce Report, and also Technical Program Manager for Intra Health International. Alex is a US-trained public health social worker and has over 8 years of experience providing technical and managerial support to social service and health workforce strengthening projects at the global and country levels. And at Intra Health International, Alex is also the technical program manager for the USAID Global Orphans and Vulnerable Children flagship project. So Alex will be focusing her presentation on the key findings, trends, and recommendations from all the mappings and assessments that have been carried out and the experiences that are reflected in this year's State of the Social Service Workforce Report. Over to you, Alex. Thank you.
Even better. And the accompanying recommendations, which are linked to the call to action and also touch on the forthcoming mapping toolkit and other areas identified for future investigation. So as we stated in the foreword of this year's report, the Alliance's hope has been from that first report released in 2015 to today that more and better data would become available as countries engaged in further mapping exercises, as governments got behind investment in better systems for tracking this data, and as donors and other key players aligned indicators to measure progress. And pulling from all the available mapping exercise data, we aimed in the report to provide a multi-regional picture of the social service workforce, pulling from the 36 countries that had mapping exercises conducted over the past 2 years and the Alliance's broader experience supporting mapping since that first 2015 report in 41 different countries. We focused on 4 major areas in the key findings: the size and composition of the workforce, education and training, professional associations supporting the workforce, and workforce supportive policies and legislation. And where available, using the worker survey data, we wanted to tie in worker perceptions of their professional environment, the supervision they receive, and their opportunities for continued professional development. And I'll highlight just a few observations from each of these areas, as I think a lot of the speakers ahead of me have brought some of those findings into their presentations, and hopefully we'll all be well-versed in them by the end of this panel. So first and foremost, as others have highlighted, the country's determination of who should be included and thus counted as part of their workforce is a huge influence on not only the estimations of size, but also resulting worker to population ratios, assessing the titles used, the roles and functions. And so this applies to all of these 4 focus areas. So first off, using the mapping data available to estimate ratio of social service worker to child or other population facing difficult circumstances, this helps us indicate whether there are enough human resources in the system to ensure that workers are not only available, but they're responsive. And having an adequate number of workers in place also increases the likelihood of reasonable caseloads, which we know is a huge determinant to retention of these workers and their ability to provide quality services. And the figure we see here is a geolocated depiction of the country ratios that we were able to calculate. The larger, darker circles indicate a greater number of workers to population, in this case child population per 100,000 children. And the smaller, lighter circles show areas with fewer workers to population. Again, it's important to note that here, countries' contextualized workforce definitions are resulting in really diverse representation of which workers are counted here. In both East and South Asia, you'll see perhaps a range in ratios, ranging from the very small circles to larger ones, and this is likely more attributable to differences in population sizes between ultra-populous countries such as the regions in India we are able to represent, and smaller, more sparsely populated, such as island nations like the Maldives. And constructing proportionate samples, such as Nadia alluded to, was not possible given the methodology and also the range of contextualized definitions involved. And for this and other reasons, we're not really recommending cross-country comparisons at this point due to differences in definition, the data available, and interplay of population, geography, and other contextual factors. And so even though our hope is that at some point there would be a way to calculate a globally recommended ratio, that's really more of an aspirational goal at this time. However, it is helpful and produces important evidence of progress in recruiting and retaining workers when we compare ratios year to year within one country or longitudinally. So that's definitely an area where we can use this data to monitor progress. So who engages all of these workers? In most countries, the main responsibility for social service provision rests with the government and is often spread across a variety of ministries. We saw that to be the case with the workforce mapping in these different countries. All of the countries involved reported more than one ministry employing social service workers, the most common being social affairs, followed by health, law, and justice. And this spread of authority, be it for service provision, retaining or recruiting or hiring workers, has implications on how available and reliable workforce data is, especially if these functions have been decentralized. And we saw that to be the case among the different mappings. Thanks to the worker surveys conducted in East Asia, Pacific, and the MENA regions, we were able to take a peek, albeit not rigorously, but in some way at the gender makeup of the workforce. Among those countries for which data were available from the surveys and released, only Indonesia, as you'll see here, showed a slightly higher percentage of male than female respondents to the surveys. And all the other countries' survey data indicated a majority female workforce, at least in line of the female majority respondents, ranging from over 50% in Cambodia to over 80% in Lebanon. And we expected this finding given similar trends in other so-called caring professions such as nursing and education. And it was more motivation for us to explore really unique questions around professionalization and gender, as well as any lessons that we could learn from these other professions that have raised the profile of their workers in a female majority workforce. For example, what are the opportunities for upward mobility? And are they the same for men and women? What does it mean for workforce development if those making the planning decisions are majority male when the frontline workers are majority female? And as we saw in Djibouti, how much is working in the social service sector seen as an extension of the private domain, i.e. caring for children and family, a form of labor that could be less valued and potentially pose a stumbling block for achieving meaningful recognition, remuneration, and protections. But at the same time, it's a huge opportunity. As an employer of predominantly women, there's great potential for the social service sector to contribute to SDG 5 and achieving gender equality, and a similar connection between women in the workforce and the opportunity it presents for economic growth. That's why I was excited to hear about the business case undergoing in Cambodia. It presents an opportunity for economic growth and increased equality. That connection's recently been made for the health sector. Moving from size and composition, the worker surveys provided us some insight on how workers perceive the opportunity for further training and the supervision they're receiving in their jobs. In 7 of the 9 countries for which data were available in East Asia, Pacific, and MENA, 80% or more of workers reported a need for additional training, and those specific topics were included in the country or regional reports. In all 9 countries, half of the workers expressed that they were satisfied with their current in-service training options available. It was interesting to see in the Europe Central Asia region continuous professional development or in-service training requirements written into legislation overseeing the profession or mandated for members of professional associations. We also see supervision as a key part of any workplace, but within the social service workforce, supervision is expected to go beyond more administrative functions and serve a continuous professional development and support function. And among 10 of the 13 East Asia, Pacific, and MENA countries with worker survey data, more than 80% of workers reported having an immediate supervisor, and in all 13 of the countries, more than half of the workers stated that supervision that they received was effective and met their needs. And I think this finding indicates that as we think about how supervision can be strengthened, we can take heart that it can be taken to that next level of professional development and support because the structures are in place. Outside of government, professional associations play a key role in supporting the workforce and its development. Encouragingly, of the countries included in the regional mapping exercises, 3/4 had evidence for at least one professional association for social service workers, the earliest formed that we saw being in the Philippines, founded in 1947, ranging most recently to the Association of Professional Social Workers in Cambodia, founded in 2015. And data on professional codes of ethics were either reported by the association itself or gathered by worker survey. And of those associations included in the research, 50% reported a code of ethics, or a majority of workers surveyed reported knowledge of one. Finally, public sector policies and legislation form the basis for workforce strengthening. Most countries reviewed had laws, policies, or strategies in place that provide a legal basis for social service provision or reference the workforce or a specific cadre, such as child protection workers, and their role in providing services. A small percentage, which you can't see here because they're showing up as values. So a small percentage, 11% of them, had a law in progress, such as Indonesia and Morocco, or a law in place, around 13%, like in the Philippines, where their legislation was passed in 1965, the original piece of legislation in Georgia, where the social work law was passed last year. And UNICEF, alongside professional associations and government stakeholders, have been at the forefront in supporting legislative efforts on behalf of the workforce, and clearly there's a need for action in this area. So the end goal of each mapping assessment was to facilitate countries' formulation of data-informed recommendations and really to spur implementation of interventions to strengthen the workforce in line with a national workforce strengthening strategy. And in the report, we aimed to distill common issues. It was a huge slew of data based on the data from all the available reports, and then accompany each common issue with a related action-oriented recommendation that could be pursued at the country or the global level. And I'll go over those recommendations now briefly. And I'm thrilled that many have been touched on before in the keynote and the prior presenters, and would love to discuss these further during the Q&A or during the break, so please don't hesitate to find me or others who've been involved in the report. In terms of planning, we observed that estimates of workforce size and composition relied mostly on government data, and a concern was that this may not accurately reflect the huge number of workers involved with non-government entities or NGOs in providing social services, and also the fact that data was rarely pulled from an HRIS, which could provide more up-to-date data and reliable results. And having an HRIS for the social service workforce, or even a specific cadre with SOPs and secured resources in place for ensuring it's kept up to date, will enable national and subnational stakeholders to make data-informed workforce planning decisions on a regular basis, rather than relying on a one-off mapping that may occur every few years or vary in methodology or scope, despite efforts to standardize the approach with the mapping toolkit. And related to this reliance on government workforce data, NGOs and other non-government entities should be brought into seeing the purpose of the mapping exercises and the value they can bring to their work. And we see a need for more advocacy to rally this robust and representative non-governmental participation in mapping exercises, and look into the reasons why they may not have been as engaged in these ones that were reviewed for the report. In terms of developing the workforce, education and training opportunities are available, varied, and growing. However, PhD programs, quality field education placements, and formally recognized certification programs and short courses are limited. And our recommended approach here is that we should pursue a holistic approach that reflects an understanding that a degree or higher education is not always required or the ideal scenario for all social service workers, as some researchers have shown a greater connection between the worker and clients when they have a similar background and level of education. Another important facet of strengthening the workforce through training is ensuring the relevance of training to local context and population needs. And we saw that the field education requirement was embraced by many of the countries in the report and could play a role in contextualizing or indigenizing social work theory and practice in real time as students are emerging from their field placements with experience and understanding contextualized to the environment in which they were placed. And this could bolster more direct efforts to adapt curricula. In terms of supporting the workforce, we've seen that professional associations are widespread, but a lack of formal or legal recognition could limit their capacity. And this formal recognition really could empower associations to set professional standards, provide opportunities for continuing professional development, and monitor progress against those standards, leading to registration or licensing as appropriate for the country. In case studies, we recommended to document the impact of government recognition on an association's ability to play an effective support role, would be welcome additions to the knowledge base, and could also be motivating to countries seeking to establish new or revitalize existing professional associations. And in terms of individualized support, although most workers reported having a direct supervisor, far less are satisfied with the supervision they're currently receiving. And from the worker survey responses alone, it was difficult to deduce how workers understood the role of a supervisor and their expectations around supervision. And we should be aware that not only is supervision serving an important quality assurance and monitoring purpose, but it contributes to our greater aim of enabling workers to be competent and ethical practitioners. And in whatever form, this guidance should help counteract any misconceptions around supervision and underscore its importance for professionals and paraprofessionals alike. Lastly, there are a few cross-cutting observations and recommendations. First, that few countries, as we saw, have legislation or policies specifically defining the workforce, and that country task groups, using a participatory process backed by available workforce data, can help ensure the development of a definition that's contextually appropriate and specific to the population and development needs. And then in countries studied for the report, women made up most of the worker survey respondents, and possibly this reflects the female majority workforce, which has unique implications for professionalization. We should think through Global actors, including networks like the Alliance, focusing resources and expertise among staff and members towards a better grasp of the role of gender in social service workforce strengthening, and further refining actions that can be taken to promote gender equality in line with SDG 5. Thank you so much, and I'll hand it now back to Kirsten.
I think we can now head for the questions from the floor. So over to you. Any questions, any clarifications, any points you would like to raise, comments? Yes, I see one very courageous person. Please go ahead. And if you can introduce yourself briefly to everyone before speaking. Thank you.
I can shout. Hi, I'm Karen. I'm CEO of Children and Families Across Borders, which is a UK-based organization, and we worked with 134 countries last year, facilitating international social work issues. Congratulations on this fantastic report. It definitely puts evidence to a lot of practices and issues that we've seen on a global level on an informal basis, so it's really, really useful to have. The question that I have is I guess the first question I have is, how were the countries chosen? Sorry. So my question is, how were the countries chosen? I noticed that you said that the majority of the countries, if not almost all of the countries, had some either policy or legislation around defining the social workforce. And that leads me to my second question, which is, and maybe this is in part for UNICEF, how are we going to focus on the countries that don't have those definitions, those policies, that legislation, because those are the countries that possibly need this even more?
Okay, before maybe we take those questions, any other questions from the floor? Yes, please. You're in the front.
Good morning, and my name is Gary Newton. I'm the Policy Director with Whole Child International, and I thank you all, the Global Social Service Workforce Alliance, for your fantastic work over the years. Whole Child International is working in El Salvador at the moment, working with government on a number of things, including to do a social service workforce assessment and mapping. But my question is a general one related to what you have found with respect to your mapping and assessment efforts to date. I'm assuming that you said that most countries have at least established a baseline. You've established who's there. Can you offer examples where that information alone has been helpful in trying to focus who's there now on the top priorities? Assuming there are not enough social workers, and there won't be enough social workers anytime soon, are they focusing on the top priorities? For example, in El Salvador, there are thousands of cases of abuse and neglect reported to government, a high level of cases reported, and very few responded to. So one would think if our mapping in El Salvador leads sometime soon, we hope, to the government employing more social workers, they would be employed first and foremost to deal with that issue, that priority issue. Thank you.
Thank you very much. I'll take one more question and then we can start having some answers. Please, I think I see a colleague. If you can briefly introduce yourself for everybody, thank you.
Sure. My name's Elaine Wiseman. I'm from International Social Service USA, which is also part of Carolyn's network. We have partners in 130 countries, as she said, and we have a program right now working in Central America, and so doing some mapping in the countries of Guatemala, Honduras, and El Salvador, specifically around children who are returning to the region. And one of the things we're finding is that there is a difference in the resources and the social service resources in urban areas versus some of the more remote areas and villages in other parts of these countries. So my question is, if in any of the countries where there was a mapping, if you found any variances or considerations around urban settings versus rural settings, and how perhaps those contexts differed in those definitions, and who the social service workforce is really considering based on those settings.
Okay, thank you very much. So maybe I'll give the floor to Natia to get going, maybe on some of the initial questions on how were the countries, methodological questions, how do we choose the countries, and how do we make sure we also focus on those countries who don't have definitions and legislations and policies on this, because of course we would like them to pay more attention to this topic.
I'll give it a try, and if any of you would want to add to it, that would be nice as well. So on how the countries were selected, we've mentioned that all these mappings were done with UNICEF, in partnership with UNICEF, in partnership with the regional offices and country offices of UNICEF. Selection of the countries was done by the UNICEF regional offices, and the way it's understood is that it was depending on the willingness of the country to participate. However, our experience shows that it was not necessarily linked with having or not having legislation or definition in place, because maybe we've talked more about the countries where it was obvious that they had legal framework. However, most of the countries, I would say, didn't have legal framework, didn't have very clear definition, and so by doing this mapping and assessment, we're actually trying to have a common understanding on who is the social service workforce and how this situation, with the lack of the definition, sometimes will be used for defining the legislation or framing the policy. So that was the way how countries were selected. And I'll give a try on baseline as well. In IAPRO and MENA, this is still work in progress. We are at the last stages of mapping and assessment, where countries have validated findings, but are now at the stage when they will have to plan based on this finding. So it would be difficult for me to have you a very kind of decisive answer on how the findings were used, though there are some examples already. But I think I can give you an example from Georgia, even though this was not the country where Alliance supported the mapping, because I'm from there. I live in Georgia, and I've been involved in the field there for years. It was mentioned by Aaron that the country adopted the law on social work last year, and to some extent it was the outcome of the mapping process there. I wouldn't say it was only because we've had these baseline findings from the mapping, but it confirmed the need of having this legislation adopted, because the decision makers were finally convinced that most of the statutory social workers, especially in child protection field, didn't have qualification in social work. And on one hand, it meant that they had to come up with legislation to regulate this field. On the other hand, it meant that they could not start certification only based on the qualification requirements, because if they wanted to do so, they would have lost 80% of the workforce in the field. And that was, of course, not the option. And we all knew that we needed people who didn't have social work qualification, but were so important in the field for years. So now we have this transitional clause in the legislation, which will allow people without social work qualification, but with the experience in the field, to get registered, to go through the certificate training that Aaron was also mentioning about, and it will continue for a few years. And after that date, I believe it's in 5 years, then the country will enforce the regulation of certifying only qualified professionals. But until then, we'll have this transitional period, and baseline findings from this mapping somehow helped this decision and adopting this legislation. So if I've answered it at least partially. Yeah?
Yes, I think absolutely. I think the process itself of undertaking the mappings, arriving at a national consensus, involving all the national stakeholders, in many countries has just generated much greater momentum and understanding what is needed. And in many cases, we did not have the legislation and the policy in place, or if we did, it led to a realization that those policies and laws perhaps needed to be revisited, reinforced, or adapted to the reality of the outcome and the findings of the mappings and the true state of the social service workforce in that particular country context. Now, I understand we had also a question about the urban-rural. Maybe I can hand that one over to Alex to try and respond. Thank you.
Sure, yes, thank you. So what immediately came to mind was some of the difference in urban and rural distribution found in the MENA region mappings. And so when that regional report comes out, I think it will be interesting to see then what the resulting national workforce strengthening strategies are coming out of that. What we weren't really able to get into in the report was that next step in terms of what countries decided to invest in, be it an HRIS to track where workers are based and to monitor that urban and rural distribution, what the budgetary allocations are for recruitment or retention incentives to work in posts further aflung. And so I think that's definitely something that can come out of the mappings and how you continue to monitor and address an unequal distribution across the country.
Thank you, Alex. And perhaps to add to that, and of course, many of the findings show that the functions that the social service workforce performs and the capacities they have are usually quite significantly different from urban to the rural areas, of course, with usually in the rural areas, these capacities and functions perhaps being, I'm not saying less important, the functions may be extremely important, but certainly the capacities may be still lacking more so than in the urban settings where more highly qualified social service workforce usually tend to concentrate. So absolutely very critical to any capacity development, building strategies for the social service workforce to take this into account. So moving on, I think I want to give an opportunity also to colleagues in the field who maybe would like to ask some questions. I see Nicole is stretching her arm, letting me know that there are some questions we received from colleagues in the field. Nicole?
Sure, thank you. We do have a few questions from our online viewers. One asking how the different methodologies could be applied or used in different regions that weren't included in this mapping, particularly in regions in Africa. And then a similar question from some folks interested in undertaking mappings in their countries or their regions, inquiring on the mapping toolkit and how they could potentially use that and what's involved or included within that.
Yes, thank you very much. I think, Nadia?
I'll start with the methodology in the toolkit. I think when developing the toolkit, which, as it was mentioned, was based on the experience of our work in these countries and also previous experience, we've tried to make sure that it's flexible and that it allows countries to adapt the tools and the approaches to their own context, which means that, first of all, the tools which are suggested to the countries can and should be contextualized, meaning that they are asked to review or discuss these existing or proposed tools in the country with their key stakeholders and decide which parts of these tools will be used in the countries. There are some optional parts of the questionnaire also which can or cannot be used in different countries, and some of it is related, for example, to the education systems in the countries. And also the second tool, which is a worker survey, the way how it was adapted in this process, and it can be adapted further by other countries, is first of all, of course, by contextualizing, making sure that the concepts included in it and questions included in it are understood and appropriate for the country, but also how this tool will be disseminated. Because as I've mentioned, in some countries it was possible to use the toolkits through online sources, and we've used SurveyMonkey, for example, in many countries, and there were some countries where workforce representatives simply didn't have an access to internet and were not able to respond to these questionnaires online, and in those situations we've interviewed them directly, we've organized focus groups, and that's how the use of the methodology was adapted in this situation. Also, another thing is that the mapping toolkit, which is like already issued and will be used in the countries, is guiding the process, step-by-step process for the national mapping, which is easier in a sense that it gives more flexibility for adapting the process, because when doing this process at the regional level, we had slightly less flexibility because we've needed to make sure that we've had findings then comparable to each other across the region.
Okay, moving along. Any other questions from the floor? I see somebody over there.
Yes. Okay. Is this on? Yes. I'm Melody Curtis from Helping Children Worldwide. Most of our work is in Africa, and I am curious as to whether or not the mapping that was undertaken was always sanctioned government mapping, or was it performed by professional associations or less formalized groups? Given the, I would concur that the majority of the workforce is not university-trained social workers, definitely in Africa, that's not the case. And the vast percentage of the workforce in Africa would be supported by NGOs. So I'm curious as to whether or not any of the existing mapping was done in a ground-up sort of situation.
Okay, I'll take a few more questions. I think our colleague here from Uganda in the front, and then we have two more I see at the back. Or we start from, okay, the microphone, yes.
Thank you, presenters, and of course, she has also eroded what I'm looking at. I'm Byamukama Michael from Uganda. I work with the Regional Psychosocial Support Initiative as the country representative, and also Uganda National Association of Social Workers Association president. Which is related, the data captured that big number, it's related to what she's asking, is with the government, when I looked at, but from the African side, and Uganda, if I am to be specific, you realize a big percentage, more than 50%, they are with civil society organization. That's where most social service workers work, and social workers who are professional. So we need to look into that, especially when it comes in terms of recommendation. What should we recommend as far as that is concerned? And of course, also the data brings out percentage of more female than males. What is the implication in terms of service delivery? Considering that we are looking at strengthening the systems for child protection systems and service, quality of service at service point. And there was also something from a colleague that is, I think, alone, that social work degree courses are being offered across different universities. Possibly should give us more light, especially in quality standards control. From again experience is they offer these degrees, others would say Bachelor of Social Work, but when you go deep into the quality, it is something different. That's why currently, for example, in Uganda, we're working with the National Council for Education and other universities. We are finalizing the generic curriculum and the minimum standards for training and educating social workers, so that there is that standardized way of doing things in terms of quality. Then also the training, possibly making a recommendation, which is related to that. It is in terms of the way we offer trainings at institutional level. Some institutions, they do more of a training based on objectivity rather than outcome. So is also related to that as we recommend. Something maybe I missed it, especially creating the career path for the para-social workers in terms of competence development, in terms of training, and also at national level in different countries. Everybody comes running to them, but you realize they don't even they have, I know at Alliance we have developed the competence framework, but we need to push more for countries to adopt and use it so that they have national-based competence guidelines and framework to regulate. Because I normally call them social doctors at that level. They offer services which are very critical. And lastly, of course, different countries we are struggling with the legislation. And it's good, it picked that actually, I think it was also Alon who talked about that most social workers in the government, in department, they are not social service workers. They occupy those critical areas. But we need to learn especially to work with them so that they support the advocacy efforts as we move forward to advocate for the social service workforce. In other words, when it comes to the mapping, even at national level, the government should take a key role, government institutions and government departments, so that they own and it's easy for us to roll it out. In Uganda with For Children, we have just concluded mapping, and the government plays a key role. So it becomes easy, in other words, of actualizing, rolling it out. But otherwise, the survey is good, it's critical. The recommendations that they will help us move a mile as far as social service workforce strengthening is concerned across the globe. Thank you so much.
Okay, I'm a little bit conscious of time, so maybe we just take these two questions before we take another two final questions. So basically focusing on how much civil society organizations, were involved in these mapping processes, given that the reality is that we do have a lot of professionals working also at community level, where the civil society organizations may be much more closely linked to, but also the gender dimension, the quality, the standards, and the paraprofessionals, and how we make sure that those are fully included. Maybe over to Alex.
Mappings, as Nadia mentioned, so they are all based on the willingness of countries to participate, and so government-sanctioned mappings. But the case, one interesting case where professional associations were really given the lead to facilitate the mappings was in the forthcoming results for Iran, where the professional association was delegated the role by government to facilitate the mapping, and so we're excited to see where that leads and to see what profile that has given to the professional association there. And then in terms of that recommendation for more robust participation and inclusion of NGOs, CSOs engaging social service workers in the mapping efforts, it was definitely a challenge cited across all of the mapping exercises, and there are two cases that came to mind for me where there was really high participation of CSOs and NGOs was in Jordan and Lebanon. Due to varying reasons, they had much higher than the other countries' participation of NGOs in the mapping, either in the workforce surveys, the worker surveys, as well as in the more administrative surveys. So I can chime in on that.
Okay, we also have Joe Rogers from the Europe and Central Asia region, who is online, who can hear us, who has also some response to some of the questions raised. Let's see if this works.
Hi, thank you. So there's been an interesting dialogue and discussion response on the YouTube channel. So Joanna Rogers said that she would like to respond to one of the questions about prioritizing, for example, child protection if more social workers are deployed. She has worked on the ECA report with UNICEF, ECA Regional Office, and so she's able to respond to some of that work in these questions. She states the call to action prioritizes making sure that there are no child protection specialists without social work degrees in the countries of the region by 2030. So as Aaron said, there was an agreed common definition reached at the Bucharest conference about the social service workforce in the region, and this includes child protection specialists. And it's important to note not only that such positions are open, but they're also defined clearly in terms of the functions and competencies of the personnel deployed. So thank you to Joe.
Okay, thank you very much. Unfortunately, I've been told we're running out of time, so for those who still have questions, perhaps we can continue these conversations during the coffee break. I will take a brief moment, the liberty as the moderator for this panel, just to maybe highlight some of the key things or takeaways from these discussions this morning that I certainly noted, but there is, of course, many more. So I think one of the first takeaways, of course, is that as we are generating this evidence, as we are undertaking these mappings and the findings are coming out, to me it's become incredibly important to see how these processes need to be led really and owned by the key stakeholders working in this sector at the national level within each country context, and how it's really important to include all stakeholders right from the start, not only the government entities, but everybody, including the civil society sector and whoever has a stake, a role to play in strengthening the social service workforce. And by engaging all stakeholders right from the start to drive this process forward, and sort of through these stakeholders reaching together collectively a joint understanding, a joint consensus of who should be part and who should be considered as part of the social service workforce, is a critical, very critical first step in this process. And I like very much the terminology used by Aaron about co-creating something, really, really all-inclusive, including the civil society and all other actors, or maybe even the youth workers and whoever really is playing a key role in that country context. And of course, we now have the toolkit based on the experience of the different mappings that gives us a lot of resources to guide and to support those processes in countries that may wish to start this process as well and who have not done so. The other critical issue that's coming out very clearly is how we define the social service workforce. And really, it's proven much more problematic than we thought at the start in many countries to arrive at this consensus. And reaching this consensus in many countries has sort of been a realization process, maybe. I know that a lot of us who've worked extensively in child protection and social service workforce strengthening through the years kind of think we understand who's part of that group of people we are talking about, but it's not evident for most people within that country context, and maybe most entities of government haven't really looked at very specifically who's doing what in child protection, what functions they fulfill, or not only in child protection, in other sectors that require social services. Who's really doing what, who's fulfilling what competencies, what capacities do they need to really do that job well and to do no harm, but really to assist the most vulnerables in countries. So it's really a realization process, and as George from Tunisia rightly pointed out, it's an overall learning process, I think, that needs to be gone through with all stakeholders. And in actual fact, I'm already hearing back from country offices, from regions, that some countries are again reassessing who should be part of their social service workforce, because when they conducted the first mapping, they realized that they may have missed important groups, or they may not have fully considered all the functions that are taking place. So some, I think, especially in the Rosa region, are now like backtracking a bit and rechecking sort of how we really counted everybody we should be counting. Also, what is very clear, for example, from Aaron's presentation, but I think across all regions, is we really need to contextualize this. Contextualize. There is no one model fits all. And, as Aaron rightly pointed out, the debate they are having, especially in the Europe and Central Asia region, about the fact that we don't want to do any harm, that only qualified professionals need to be in roles which require professional competency, so to say? And how do you ensure that you provide that quality and of care and support to families, but that you are also able to reach out to everybody? What I also find extremely interesting is what many countries said about the many, many different titles, which again adds to the challenge of defining the scope of what we are talking about. You know, Cambodia talked about 46 different titles that they are considering as part of the social service workforce, while in the State of the Social Service Workforce report, Rosa reported that across South Asia, across 8 countries, we apparently have 127 titles. So it's absolutely huge, and you know, a consensus can really only be reached by discussing this thoroughly across all stakeholders and kind of reaching your own understanding within the country context of who you want to be looking at, who you want to be focusing at, what are the strategies you want to follow, what is the vision you have for your country, and who may be allied professions, other sectors that are very important and relevant, but may not be specifically part of your social service workforce strengthening strategy and vision, so to say. And of course, this links very much to the ongoing debate that the Global Social Service Workforce Alliance is having on revising and revisiting the overall definition of who is part of this, what is the social service workforce, and ensuring that we have a more inclusive definition, you know, that really recognizes the global dynamic and the variations that exist across different countries. And last but not least, I think the very important role of ensuring that the social service workforce is really properly trained, that they have access to appropriate education opportunities and supervisions, that we cannot just take and adapt models from other countries. This has failed repeatedly, that really this has to be based, again, on the results of the mapping, who is doing what, who is fulfilling certain functions, whether in the community or at the provincial level or in the ministry, and what competencies do they really need to fulfill those functions appropriately and with care. So on that note, I would like to invite you all to a short coffee break. We will be reconvening very soon in a quarter of an hour. And then we will move on to our next panel discussion, which will focus on how we use all this evidence that we have generated to really advocate for increased resource allocation to this sector. So thank you very much, and a big round of applause to all our panelists. Thank you.
And just a reminder, a lot of the resources that were referenced in this panel are available on the back table. So the mapping toolkit, for example, if you want to take a look, there are copies in the back. You can sign up for an email version. And the left table, those hard copies, please feel free to take anything over there. Thanks.
Hello, could we ask everyone to please come back into Academy Hall and take their seats so we can start the next panel in just 1 minute, please? Thank you.
Push them like that. You ready to go?
Yeah. And then when we finish, we push again.
Yep, exactly. There you go.
Yeah. Oh, right. Thank you. Okay. But I don't know how far, in terms of my presentation. I think it's quite short. Usually okay as well, but I mean, do you think we should just you just get to go now? Will you just guide us on the
Good afternoon. Thank you all for, or good morning, depending where you are. Thank you all for reconvening. And to those online, thank you for your patience as we took a short break. So we are now going to move to our second panel of the day. And we are appreciative to John, who will moderate, and our three speakers who are joining us today to talk about and share some of their experiences in different countries and in their different roles at their organizations on how they have advocated successfully for resource allocation for better planning, development, and support to the social service workforce. So we are appreciative and look forward to learning from all of you. So with that, John, I will let you take over. Thank you.
Thanks, Nicole. Yeah, we're going to use this different format for this panel, kind of a Q&A, rather than each of the panelists doing a presentation. I'll be posing some questions to each of them. They'll respond, and we'll have 2 rounds of questions and then try to take some, hopefully have some time to take more questions from the floor. So I want to introduce in turn each of our panelists very briefly, but I can only touch on some highlights, but you do have their bios, so I encourage you to look at those. Jane Calder, to my left, is the Regional Advisor for Child Protection in Asia for Save the Children. She has 30 years of experience with programs for vulnerable children in numerous Asian countries, Uganda, Tanzania, as well as the UK. She's currently leading Save the Children's global initiative to train and credit all child protection staff members worldwide. She's co-chair of Save the Children's Global Task Force on Child Protection System Strengthening, and she recently led the development of Save the Children's Common Approach on Case Management. To her left is Zenith Tombadou, who is Deputy Director of the National Association of Child Care Workers in South Africa. Her career has been in the children's sector in South Africa, including direct services, policy work, legislation work, and advocacy. She's supported the professionalization of child and youth care work through advocacy, through standards development, and is currently on the professional board for child and youth care for the country. She's currently supporting the national scale-up of the Isabindi model, which aims to develop 10,000 child and youth care workers serving 1.4 million children. Hope to hear a little more about that. And she is vice chair of the steering committee of GSSWA. Ghazal Keshavarzian, to her left, is the director of Elevate Children Funders Group. So funders' ears should perk up at that. She has experience in multiple fields, including child protection, maternal and infant health, conflict resolution, and human rights in the United States, South Asia, Middle East, Central and Eastern Europe, and the CIS region. Prior to Elevate Children, She was with Mistral International, providing technical and policy assistance on child protection issues in sub-Saharan Africa, the Middle East, and Asia. And before that, she managed the Better Care Network. She managed also inclusive education, conflict resolution, maternal and child health programs in Azerbaijan and the Republic of Georgia. So with that over-the-top introduction of each of our panelists, I want to ask of each, in turn, the first question. So, Jane, can you share how you and Save the Children have been able to advocate for a strengthened social service workforce?
Thank you very much. Yes, I will share our experience, and I'd like to make points around 8 points, in fact, in relation to this. So, and this question about how we're actually able to advocate for the strengthened social service workforce. First of all, Save the Children actually prioritises 4 key areas in our current strategy between now and the 2030, which aligns with the SDGs. And those 4 key areas very much include child protection system strengthening. And in many ways, I think we see the child protection system strengthening as being the basis of the other areas of work and the kind of springboards, as it were, by which we actually address all child protection issues, all those 4 areas that we're actually working on within the organisation. So at the core, of course, of the child protection system strengthening work and that priority area is that of the child protection social service workforce strengthening. And within that, we are supporting the work to both plan the workforce, develop the workforce in terms of the skills and capacity, and provide ongoing support. In line with that, we are currently developing guidance on child protection systems for country offices. We see that as a major gap, and many of our country offices are really very keen and working on how to actually develop the system, how to actually strengthen the system in their countries. And so this guidance will provide them with guidance around, in relation to the social service workforce, then they will in fact be guided around the advocacy on for the skilled and competent workforce, for budgeting, for appropriate positions within the workforce, and building the capacity, of course. In countries where, such as Armenia and Indonesia, where we've talked earlier a little bit about the legislation, but we've been advocating successfully, really, in say, Armenia and Indonesia, for the legislation and regulations to establish professional social work. We very much focus on training and capacity building, both of government and of NGO sector, in relation to the social service workforce, and those particularly tasked with protecting children at the family and the community level. And we've had a real focus on those at the community level, such as parasocial workers, the community-based groups and the structures that have the responsibility for protecting children. So there's a number of countries have really prioritized this, and this is ongoing in India, China, Indonesia, Zambia, Laos, and Egypt. We also establish partnerships, and I think we're really very keen to establish strategic partnerships, and I'll talk about a couple of those partnerships. So, for example, Bandung in Indonesia and in the UK, we have partnered with the Council for Awards of Care, Health and Education, CASH. And with both those partnerships, we're working in different countries. So in Indonesia, obviously, with Bandung University, we have worked with the lecturers there. And I think this is an area that really is a challenge for many of us. How do we develop the academic courses with lecturers who may not have the experience and the expertise to lecture and to support students to come out the other end with that expertise and that experience, enable them to work with families and with children. And so we have involved the lecturers in our programs, and they have come in and supported and provided supervision to many of our staff, our caseworkers, for example, out in the field. And through that, they've learned and been able to bring that into their lectures. So what we have is advantages for the lecturers, advantages for the students, and advantages of that kind of model and that experience for Save the Children as well. So that's a really interesting partnership. The other one, as I said, is with the Council for Wards and Care, Health and Education in the UK, and we're working with them to have them support us in India around the assessment and potential accreditation of different positions in child protection in India, and looking at that being extended to Myanmar. As John mentioned, we've also worked very much on what's called common approaches, which is really our best understanding of how to address a particular problem. And for example, we have recently developed common approaches around parenting without violence and around case management. These common approaches are then shared with both government and NGO child protection workers in order to build and strengthen their capacity in different areas. I think another key area that John mentioned was this, the need to develop our own staff. And often what we're doing is actually expecting them to provide support to government without necessarily, recognizing that they're doing that without the qualifications in social work. So we're really working on a competency-based approach to help them and to support them to actually do their job. And then lastly, in relation to advocacy, we share information, we share the global social service workforces, the webinars, that all goes out on our workplace, which is Save the Children's Facebook. And so sharing that and the call to action, etc., it really all plays a part in terms of the advocacy for strengthening the social service workforce. So thank you.
Thank you, Jen. Zenny, how is the National Association of Child Care Workers in South Africa, as a professional association, secured resources for planning, developing, supporting the child and youth care workforce?
Thank you. Thank you very much for the opportunity to present. The National Association of Child Care Workers has contextualized its development and growth in the dynamic reality of South Africa. However, the lessons that we've learned in this journey, I think, would be significant to the development of professional associations, both social work, child and youth care work, and others. I think one of the things we did in planning the workforce was right at the outset, created a national network of child and youth care workers. Child and youth care workers in South Africa exist in every province, in every district. This allows us to bring in the diversity of culture, the diversity of context, rural, urban, and allows the professional association to be infused with the richness that this diversity brings. So our programmatic responses and our responses as a professional association is grounded in this reality. But from a resource point of view, importantly as well, is because we are located nationally, we can access resources at a national level. For example, you would find the mining companies would be interested in supporting the development of child and youth care workers in the mining areas. The wine farmers might actually see an interest in supporting the development in the wine farm area. So in that way, we are able to access resources for the development of child and youth care workers. I think also importantly, we kept our focus on the service recipients. We service children in the context of family and communities, but also children in residential care and foster care. And our focus on the children allows us to build a workforce as a parallel process of servicing children. So yes, we're servicing children, and our interest is to service children, and the core business of child and youth care workers is to service children. So obviously, logically, funders should be supporting the development of the workforce in the best interest of children, and that dynamic is something we've actually presented all the time. I think the last point that is interesting around the planning of the workforce is that we established ourselves as both a professional association and a non-government organization. We are registered as a non-profit organization, and the non-profit organization side of the NACCW gives us the opportunity to raise funds, to present programs to be considered for funding, and we are able to, in that process, raise funds that actually feeds the professionalization of the child and youth care workers. So we service children by demonstrating the role that child and youth care workers can provide in their development, and they become the core business of our service delivery. Around the developing of the workforce, if I could say that we have developed a demand for quality training. So people want to see good services to children, so they understand the value of training the worker who is going to provide that service. We have provided localized, cost-effective training by actually going to communities where child and youth care workers are and training them there. In that way, we've been able to also embed local realities, local culture, local context into the training, which has made it richer and more relevant for the children that we service. And just to say as well that we have developed programs and models that showcase the practice of child and youth care. In a social work-dominated social service workforce, it is important for the practice of childcare workers to be clearly identified and clearly seen. And I think that we've managed to design programmatic responses that show how the child and youth care workers work, obviously, in multidisciplinary teams. In supporting the workforce, I think I want to very carefully say we've linked donor priorities to child and youth care workforce development, which means we haven't actually adjusted our development to the donors' needs, but we've helped the donors see the value that we actually can offer to their own personal agendas. We've contributed to nation building by promoting national and provincial policy and legislation, and we've actually promoted the professional regulation of child and youth care workers, which has raised the status of child and youth care workers in South Africa and allows us the opportunity to continually demand for better working conditions, salaries, and opportunities for the growth of the child and youth care profession in South Africa. Thank you.
Thanks, Danny. Ghazal, can you tell us about Elevate Children's the funders group, what role it's playing in convening and supporting collective action in the field of children and youth affected by adversity?
Thank you, and thank you to the organizers. I actually was in Cape Town when this idea first formed, so it's great that it's blossomed to this really engaged and informative network. So I think most of the people in the room aren't funders, so they probably don't know about what a funders group or affinity group, which Elevate Children is. So Elevate Children is a network of now 22 foundations, and the focus is on children and youth affected by adversity. And we focus across the life cycle, so from birth to adolescence plus, with a specific focus on violence, abuse, and neglect. And Elevate Children first started back in 2011. It was a child protection funders group, and they changed the name to Elevate Children in 2014 with the recognition that if you want to address child protection issues, you don't just need child protection actors around the table, that it needs to be multi-sectoral. I joined in 2016, and when we joined, and at that time, Elevate's focus was on violence prevention and children's care. I joined in 2016, and we did a review and developed our first strategy. And within this review, we decided to broaden the mandate to children and youth affected by adversity. Just talking to, at that time, our membership was around 10, 12 members, but even talking to the broader foundations, we realized that this very narrow focus wouldn't necessarily be a forum or a network to really ultimately leverage resources for this issue area. So our role, I always say that, we're, as a network, we're there to support our members to be more effective grant makers. And just to let you know, I'm speaking on behalf of the collective and not as individual members. And we support our members in terms of being more effective grant makers by creating a really safe space where they can share their strategies, they can find ways of aligning pool funding, finding ways of efficacy and collaboration, deepen knowledge through peer learning, and also one thing that we've been doing more and more, and particularly last year, is around research. So as a group, both commissioning research in specific issue areas and doing funding trends and analysis. Right now, we don't have a very clear sense of the amount of funding that's going to this sector, and that's something that we hope in the coming years we'll be able to do more around. And I mean, one of the kind of goals around this research and kind of this learning piece, I mean, the ultimate goal, mission of Elevate Children is to elevate this issue across across philanthropy, across the community, and really to leverage funding. By showing these gaps and showing kind of areas for more funding as a way to bring others to the table and really have a conversation of where funding needs to come in. We are also doing a lot more around joint advocacy and kind of knowledge sharing, working across donors, so working with bilaterals, and also working with other funders groups. And when we developed this new strategy and, with Elevate Children's name, one of the things that we were doing was we need to make sure that we work across sectors. So we've been working with other funders groups, so in education, peace and security, human rights, so ensuring that we're bringing children's issues into spaces where children's issues aren't necessarily discussed.
Thanks, Ghazal. Okay, second round of questions. So Jane, I've got a two-part question for you. Would you give an example of one of the countries where you work and how you've worked with the government and NGOs to increase the effectiveness of their respective social service workforces, and describe how this has improved the protection of children?
Okay, thank you very much. Yeah, I'm delighted to answer this question because I'm really excited to share the work that we've been doing to strengthen the workforce in India, within the Integrated Child Protection System, which is the national system that was launched in 2010 by the government. And it was launched with what is a district child protection unit in each district, and then the idea is that this is actually rolled out throughout the whole country. But what we realized that with many of those who were populating the district child protection units, and many of those who were populating the integrated child protection system in general, really weren't capacitated with the kind of skills and knowledge and experience that they required for their jobs. So we've worked in 2 states, in Bengal and Jharkhand, and we have got two areas that we're working on there, 2 things we're doing. And one is strengthening the capacity of those district child protection units, and we've selected 4 positions out of the total of 11 positions within these units. And we're also piloting a community cadre, so a cadre of staff at the community level who are doing the work of the paraprofessionals, parasocial workers. There was a gap, rather a large gap in some cases, depending on the size of the district, between what was happening at the district level and what was happening at the community and family level. So we're working with those state governments to pilot this community cadre within those 2 states. So we're aiming to demonstrate its value, or demonstrate the value of that community cadre, and advocate for that particular cadre to be included into the ICPS. So using the approach that we have in this slide, I hope people can see it. But this is the approach that we've been using in India. So we've started with clear job roles. The guidance from the government initially was about 1 paragraph or less for each of the job roles in the district child protection unit. So we have worked with the state governments and with the districts themselves to develop the clear job roles. And based on the job roles, we've worked on the development of competencies, which in India, we've really worked with occupational standards, which fits with other occupations within the government system. So that we're aiming to actually have this fit in and match with the ways that other occupations are professionalized through these occupational standards. We then aim to train staff in the positions based on the competencies. So the training is very much aligned with the competencies that are expected for their job roles. And that training may happen in a sort of series of trainings. It's not a one-off. It's, you know, phase 1, phase 2, perhaps, and phase 3. We're then providing support and supervision on the job, and much of the support would be around helping those in these positions to produce the evidence that they're meeting the competencies, or in this case, the occupational standards. And then either retraining or supporting them to meet those competencies. And ultimately, we're aiming for, we haven't quite got there yet in terms of actually, you know, agreeing on this with the federal, with the national government, but we're aiming to then have, you know, aim for accreditation of those positions so that the training is all aligned. The job roles, the competencies, the training, the supervision, the training, and the evidence. So there's assessment going on, and then the accreditation. So it's a really, well, I find it an extremely exciting and interesting approach because I think we struggle with degree courses. We struggle with our Save the Children has a tendency, or has had a tendency, along with other INGOs, to do 5-day trainings that are not joined up. So this approach really attempts to join things up. So we believe it's systematic, practical, feasible, and appropriate for the context. And it definitely allows us to also contextualize, because it's only the approach that's actually standard, whereas the actual content of the training, the aligning the training with the job roles and the competencies, etc., is all very much kind of contextualized. It also allows those in the positions to provide the evidence of their competence. Employers, government actually knows, you know, what they can expect of those different positions if they've gone through this process. So we're seeking to learn from this. We're seeking to learn and looking at replicating it, the approach, as I said, within, say, Myanmar, but also this is the approach that we're using within Save the Children itself in terms of building the capacity of our own staff and, again, kind of aiming for accreditation. So watch this space. Thank you very much.
Thank you, Jane. Zenny, can you give us an example of how NACCW's approach has worked in practice?
Thank you. I'd like to give the example of the Izibindi model. Izibindi is a Zulu word meaning courage, and it talks about creating circles of care around children and youth. But first, if I could just take a minute to pay tribute to child and youth care workers around the globe at the moment. We are celebrating Child and Youth Care Workers Week, and to all child and youth care workers globally in South Africa, and particularly the 7,000 child and youth care workers that have been developed through the Izibindi model. You are the true heroes whose success of Izibindi lies, I think, in the services that you've provided, and I'd like to say thank you to you for your wonderful work with children. The Izibindi model was designed to showcase child and youth care practice. It is an innovative model in that it was interested in demonstrating services to children and youth at a prevention and early intervention level. We talk about shifting the triangle and bringing more resources into early intervention services. We talk about not actually moving children deeper into the system, into residential care. We talk about deinstitutionalization. This model has showcased a strategic intent and a systemic way of actually shifting funding and resources to children at a preventative level. The model was crafted into a social franchise, a non-profit social franchise model, which means that all the different components of the model were clearly designed and put together in a coherent whole. The purpose was to replicate it in a way that could be scaled up, and that is exactly what happened in South Africa. What is interesting as well was that we were able to cost the model and cost the different components of the model, which also makes it a very valuable point to sell to funders and others who are interested in investing. We also spent time developing a strong evidence base for the model. We have more than 40 pieces of research evidence that indicates that the model does work, where it could be improved, which aspect of the model is significant and can be scaled up. So the evidence and the costing and the design had attracted government funding and donor funding. As the model was designed to scale up, the opportunity was given through South African government to scale up the Ezibendi model. And the scale-up model talked about 400 different organizations to be servicing more than 400,000 unique children with 7,000, 10,000 child and youth care workers to be developed. At the moment, there are 7,000 child and youth care workers that have been trained. The model also, in its core, allowed for different funders to add on different components. So some funder would say, I'm interested in substance abuse, or I'm interested in disability. Can I add that onto your spacious model so that you can actually, if evidence shows it's working, you can scale it up? It allows you to densify an integrated model even further and scale up the small components that are added in, and that brings in funding, diversified funding as well. I think that what has happened as well is that the model showcased that it could be developed into other useful innovations. We are working now with Ezibendi Ezikuleni in schools, so demonstrating the role of child and youth care workers in schools, and with UNHCR. We have looked at how an adaptation of the model could be relevant to refugee children in refugee camps. So just to say that we have 7,000 child and youth care workers being trained, 400,000 unique children have been serviced in the scale-up. Government talks about it as 1.9 million children because they count them cumulatively. So we have actually made an impact and drew donor funding towards service delivery and professional development of child care workers. Thank you.
Thank you. And Ghazal, 2 questions for you. What is the current level of engagement and funding from the Elevate Children Funders Group members for the social service workforce strengthening? And then how can that issue be further elevated and resourced?
Great. I mean, at this stage, in all honesty, it's not high up on the agenda, apart from a few of our members. I mean, GHR, which I know is a supporter of the Alliance, but now that we've grown to 22 members across the board of membership, we oftentimes survey our members for issues that they would like to discuss, and it's never ranked as one of the top issues. We are holding a webinar with Alliance later this month, so it'll be interesting to see how the members engage. I think this touches on why hasn't it risen up? I mean, I think it's really important that every single donor is very different. I mean, there's a saying in philanthropy, if you met one foundation, you met one foundation. So while we're 22 members, I can't group any of our members together. They're all very different. And so you need to really approach each donor differently and have different messages and different tactics around engaging them. And one of the tricky things is the terminology. I mean, if I mentioned to my members I spoke at a conference around social service work they'll be like, what? What is that? Like, that terminology, even though a lot of them are funding child protection related issues, the terminology doesn't necessarily resonate with them. So I think that's a really important thing to unpack, and also taking that research and evidence and telling stories, being better at communicating what this means. And how does this all connect with the notions around child well-being and healthy development? How does this all fit in? And really challenging our notions around these issues. And I think just touching on what Zenny had talked about, I think it's really what your model, I think it's a really interesting model. And one of the conversations, philanthropist foundations, they oftentimes fund local organizations. they don't necessarily fund the top level legal systems. They fund much more the grassroots. And within philanthropy, particular children's issues philanthropy, there's a lot of conversations around shifting the power dynamics, shifting that triangle. So, shifting the resources that are going to INGOs, UN agencies, down to that bottom level, and really looking at that community level, looking at child-led, youth-led organizations. And so your model, in many respects, is kind of the conversations we're having too, is that how do we shift that? How do we support the people on the ground that are doing the work and don't necessarily get the funding or the credit? And I think it's kind of shifting the notions and terminology. So, your work very much sits within that. So I think it's, working together more around kind of telling that story, and kind of being partners around that the shifts that at least in the position that I am, I'm seeing more and more. And I think the fact that you cost it, I think that's a really critical piece, that you can see exactly how much it costs, and for each individual donor, particularly some donors that may only come in with a small pot of funding, what they can contribute to that, and then scale up. I mean, that's something that, at every meeting that we have, that's always a topic that we're talking about, is how do you scale up? How do you ensure there's best outcomes for children and young people, and through kind of these different interventions. And one other thing, is linking to other sectors. How does this issue link to education, where you have a very well-defined workforce as teachers? Every single donor that you talk to knows what a teacher is. The health sector, everyone knows what midwives, doctors, and nurses are. So how, with these other sectors that are looking at the bigger pictures around equity, social justice, closing civil society space, all these issues that children's issues, the social work, are working within this ecosystem. So, how do you engage across those sectors and bring those donors and funders into the conversation?
Thanks, Ghazal. Now, we have a few minutes left to field any questions. Any questions here from the floor or from the field? Yeah, please identify yourself.
My name is Anup Hivale from India. I have a couple of questions based on the presentation and the answers that all the panelists have given. We do a lot of training programs for social workers in India, and we have found out that in the classroom we have many women students come, but in the field their percentage goes down from 90% in the classroom to 20% in the mission field because of the safety issues in India, and because of a lot of lack of resources for the excellent students in the class. They achieve very good grades. So the question is, will it be possible to, on the global level or here, that when we train these women, because they are very productive compared to the men in the children protection or nourishment. So the question is whether will it be possible for us to combine the resources and strengthen universities and colleges. The couple of them we work with, they train bachelor and master level social workers in Maharashtra and in North India. So we normally lack a lot of resources to support these women who are very productive in the field. So in those, is it possible to get together and create something where these women workers could be used for child developments?
Does anyone care to respond?
I would ask the question, so thank you for your question. But I'm just wondering, do we have an idea as to why the figure is so different from 90% to 20%? Do we know what the women, the social workers themselves are saying?
In one of our colleges in Maharashtra, we were the pioneers of starting social work in rural areas. So in the classroom, the 90% of women who come for the classroom had a desire to go into the actual rural area and work. But they had no social organization or even the government funding in order to provide them any reasonable salary and little bit of protection. Protection in terms of finding them a rented place in a reasonable area. We get cheaper rental house in an area where there is the record of those areas, high rapes, the women abuse. I'm very sorry to say that I'm from India, but India is these days it's not doing well in terms of women's safety. So colleges, they don't have any department to look into those needs. So every time we get the alumni back into the discussion, they bring many issues. But for our discussion, I would say one is there's a lack of organizational or government structure that can provide them little salary or some sort of protection that could come from their residential way that we can support them to stay. And second, very crucial thing that the drop 90 to 20 is even from which religion they come from. So we have Muslim women come for classroom, but then their family doesn't find Muslim community where they could send them as the social workers for children. So
I think Zenny has a point she wants to make.
I think just one response, I'm not too sure if it answers the question, is that one of the things we did in scaling up the 7,000 child and youth care workers in South Africa is that we actually recruited, selected, and trained the child and youth care workers from their communities, in their communities. And I think that that is a critical component to ensuring safety, cultural competence, protection of the community. Generally, they know the resources and much better because they come from that community. And that has been one of the non-negotiable approaches we've taken in workforce development. And we can, I think, confidently say that it does work.
Thank you so much.
I think we have time for one quick question, because we'll need to have a quick response to.
Which one?
Thank you. I'm Yamka Michael from Uganda. To Madam Zen, in terms of recruitment of staff, especially from our experience, when employers are recruiting, they end up recruiting in terms of, they put advert, they want social workers and all social service workers, they end up recruiting something else. How are you working closely with institutions or agencies in ensuring that quality, staff in terms of delivery are recruited, and also the area of field placement? From also our experience is that when they are graduating the students from the universities, they don't have hands-on despite practicum. Our social work profession in Uganda, we are looking at mentorship program. How are you applying that? Thank you.
Thanks, Michael.
Okay. So we localize the recruitment process. We identify the qualities and characteristics that would be what we were looking for in people who want to become child and youth care workers. Obviously, there must be an interest and capacity to work with children. But we know as well that we provide training. So we have our criteria, and we have a localized committee that makes the selection, consisting of community members who would actually know the integrity of the people who are applying, as well as local social workers, child and youth care workers, community stakeholders, educators, who would be part of the panel that would actually interview and make the selection for the training. Remember, we're recruiting, but we're still training, and during the training process, we make a further assessment of how they approach the learning in child and youth care work in the training.
I want to thank the panelists for excellent thoughts, excellent presentations, and remarkable time discipline. So, thank you very much.
Great. Well, I'm going to maybe walk and talk, but I'll head up this way. Thank you to the panelists. This set us up, I think, exceptionally well for our next activity, which is to think a bit more about how do we take what we've learned today and the important work that we're doing and translate it into key messages that resonate with audiences who might not be as closely connected to our work. We use a lot of acronyms, we use a lot of jargon, we use a lot of heavy data, but what we heard today is we need to find ways to make sure we're conveying in an impactful way the importance of our work. So we have tapped into a lot of our friends and colleagues who are working in advocacy and communications, who are going to help us to facilitate a group activity. So we're going to get up and move around a little bit. What we have going on here, I'll go through the 3 groups we're working on. You'll get to choose which group you'd like to work in, and we'll have about 40 minutes to work through an activity where we come up with the top 3 key messages we would like to share with this target stakeholder group. So the first group, number 1, are going to be messages that will target towards our UN agencies, our multilateral groups, governments, and donor groups. So those of you who have something you would really like to share with those key stakeholders will move to group number 1, which will be facilitated by Aniruddha and Alexandra. So over here, group 1. The next group is looking at the media and the general public. We talked about this morning, we're trying to engage more with folks in the media, with folks in the general public. So if that's a group that's of interest to you, you'll move over to group number 2 with Sarah and Nicole. Our third group will be over here, and that's, we said this morning, preaching to the choir. So this is messages targeting members of the social service workforce. Sometimes, even myself as a social worker for, almost 15 years now, it wasn't until about 5 years ago I really started to think about the breadth and the scope of the entire workforce. So there were messages that I needed to be hearing from my other folks and colleagues. So this group over here, we're going to look at what are the messages that we're giving to other members of the workforce, and how can we get them more engaged on these topics. So take a minute to reflect where you would like to go, and we will start to congregate over here, group 1, 2, and 3. I'll ask the facilitators to stand up. So Nicole, actually Ani and Alexandra, will you raise your hands? Great, and walk over here to group 1. Group number 2, we have Sarah and Nicole. Raise your hands. Sarah, now we have 2 Sarah facilitators, okay? They're heading this way. And over here, group number 3, we have Sarah Johnson and Susan Rubin, and they'll be heading over in this direction. So your facilitators have a little bit of a guide that they'll work you through. We want to captivate all of the knowledge in the room. This is the 1-minute warning. We're going to start reporting back in a few minutes. Well, 1 minute actually. So summarize this last point. Great, and we're going to wrap it up and report back. I think that this conversation could go on all day, I have a feeling. So I think we will start with group number 1. And we can invite maybe to get up and move around. So if group number 2 and 3 want to maybe come up over here, we can keep our blood flowing. So my first question for group number 1, how was this process? How did we find the process?
There you go. I wish I could have transcribed the entire conversation, because it was...
If you're interested, if not, then just pay attention to what's said. So how was the process, Alexander?
I was going to say, I wish I could have transcribed the entire conversation, because it was fascinating. We had a very diverse group of perspectives here coming from all different angles. So it was interesting. We talked a little bit about some of our challenges, some of the strategies that people have had success with when communicating about the work. And we tried to condense our conversation, but I feel like if we had kept talking, we probably could have filled this entire wall with different messages, just because of the nuance, the importance of contextualizing to who we're speaking with, and then the nuances of what that means, what a social worker means.
No, you keep going, yeah. So what are the key messages we came up with? Does someone want to present? Oh, there you go, you're up.
Okay.
You did best handwriting, superlative too.
Oh my gosh. I was telling them when I was in 4th grade, Mrs. Thomas would let me write on the chalkboard, and I was very happy about it. So this was a childhood dream. So we talked a lot about the investing in the social service workforce, and in some of our conversations, I think one of the thing that reoccurred, and y'all correct me if I'm incorrect, was that a lot of times people understand what a teacher is, and they understand what a nurse is, they understand what a doctor is, because they might have had a personal experience with that. But someone mentioned that it's sometimes not perceived, social work is not necessarily perceived as a universal experience, or it's perceived as, quote, the other. And so in our messaging, we wanted to be able to show both the importance of investing in social service workforce because of what it can do, but also the cost of inaction. And then helping contextualize and define what that is for people who may not know that they've been affected by social service workforce. So we also talked a lot about how this work cuts across multiple sectors, as we've already discussed at length today in the different programming. We don't know if we got that stat right from y'all's report. More than 67% of the SDGs? That sounds right? And not only is it universal goals, but Michael brought up the important point that it's also critical to achieving national and local development goals. And then we talked a lot about the effect on, that the social workers reach people at their most vulnerable points, that they target marginalized populations, and that the importance of having a professional, trained, intentional, proactive social service workforce, which I think gets back to some of the definition conversation that we had earlier today. And then last but not least, that the social service workforce is the connection between the problem, which can mean many different problems, and the solution, that they're helping bridge that gap, many gaps in many different sectors, helping reach people at vulnerable points in their lives, and sometimes you don't see the effects of that, but helping. One strategy that we would suggest is allowing people who've been affected by that to help share and build that case as part of the evidence for the importance of investing. Anything else you want to add?
Fantastic. So we don't have a ton of time for the sake of keeping it moving, but the overall objective today is that these become messages that we as an entire group here at the symposium can endorse. So if there are any ways that we could strengthen or causes for concern within these messages, we can bring them up now. Otherwise, we'll likely go ahead and fine-tune them, make a draft, and then circulate them and use them in the advocacy work that we do. I think there's one, we missed proactive in here, which you did say, and I think that's a really great word to try and get in. I think that was, this idea of not waiting for the problem, but being proactive, I think is huge. Great, good job, group one. We can make a little bit of a shift over to group two. Group two, Sarah and Nicole were our fearless leaders. How did the experience go for the group that was targeting the media and the general public? Anybody?
It was very difficult.
Very difficult. You might have had the hardest one. I don't know. What do you think?
I think it might be one of the hardest ones.
Why do you think it's challenging?
I think we have a lot of unresolved questions still about, for example, we kept coming back to children and families, but are we also talking about individuals and communities? So there's some really, and if we are talking about families, that holds a whole list of implications where we can delve into that specific issue. So we kind of suffered from that lack of clarity, I think. But what we did come up with is we have the social service workforce works alongside communities, families, and individuals to strengthen them so they can reach their full potential. So that whole idea of working alongside and empowering was an important one that came up several times. Our second one that we came up with was the social service workforce makes sure that health, education, justice, and other systems are supporting families. So there's that idea of being the glue between all these different service delivery systems. And then we have the social service workforce promotes people's strengths, responds to their needs, and helps overcome challenges. So Nicole kept bringing up this idea of promotive, responsive, and preventative. And another one we came up with is that it ensures all children benefit from a safe and happy family or community, maybe. So we came up with some, but still a lot of maybe tension and are we covering enough or which direction to go in.
All these words resonate with the general public.
Exactly.
Gary said, I thought was interesting, interesting. Gary said, imagine you have 90 seconds on a morning show in Chad, what would you say? You know, and really thinking about who your general audience would be. When we went through the ambassador program, I was in the first cohort, and Gary and Nicole led us in a 90-second elevator pitch activity, which I think is really something we need to go back to, distill down the language, and really I think this is getting us closer to where we need to be. Good job, group number 2. Okay, we're going to shift across the room, if you're up to it. If not, we're talking loudly so you can... So here we go, group number 3. To our members of the social service workforce, we had Sarah and Susan led this group. How did it go for you?
We had the unique challenge of creating messaging that would encourage the social service workforce to invest in their own profession, which, you know, as you had said earlier, it feels like preaching to the choir, but it is a little bit easier said than done, and a lot of times people in the social service workforce don't fully understand their role or their value. So a lot of our conversation was sort of geared around that and around the, you know, encouraging the social service workforce to kind of take pride in itself and understand its impact on the populations that they work with. So our first key message to them was to commit to yourself, to your practice, and to your learning and growth, all with the understanding that this has a huge impact on families and children and populations all over the world. The second was to identify yourself as a professional, take pride in your role, and to understand your vital impact. And the third was to recognize the importance and strength in solidarity and in forming coalitions and collaboration.
That's a perfect message to wrap up on. So I would say we'll keep these up for a little while and think about them. If there's anything that doesn't resonate with you or you don't think is something you want to endorse or you have another idea of how to expand, there are some Post-it notes available, and before you leave, feel free to write a Post-it note and stick it up on any of these flip charts. And that way when we work, Nicole will probably be leading this process as our crafter of all advocacy messages. We'll make sure that they're truly inclusive and endorsed by the group. So thank you so much. I'm going to invite you to take a final seat, and Rebecca Davis will give us a few closing remarks. Well, actually, Stephanie's going to grab a quick group picture, so just move in right there. And then Rebecca's going to lead us in a few final remarks. Stay right where we are. We don't have to... Oh, we're facing this way. Okay, we're just going to turn and look at Stephanie.
Yep, just look at Stephanie. Yep.
Give her a wave. Here we go.
Oh, that's a perfect picture. So we have like a serious one first. And then if I could get everybody to like wave or yell or anything. Oh my goodness.
Social
That's
service.
The quietest wave I've ever experienced. Thank you guys.
Great. So I invite you to take a seat, and Rebecca's going to wrap it up for us.
Well, first I'd like to thank all the presenters, and I'd like to thank all of those who are online for your participation as well as everyone that came today. So I've got a hard part of kind of wrapping things up. So I'm going to make some comments and then I think maybe give a little challenge as well. So it's clear that much has been accomplished in moving the agenda on building capacity of the social services through workforce strengthening initiatives. I think this agenda of addressing system needs through a workforce lens has been building now for maybe around 10 years, still fairly new in some ways. This has been done through legislation and policy, development relative to the workforce, standards and accreditation for professional and paraprofessional workforce, emphasis on social development initiatives such as social franchises to address poverty, making sure job descriptions are consistent with occupational standards and competencies, introducing performance reviews, etc. This has increasingly legitimized the work through a range of top-down and bottom-up approaches simultaneously at the global and local levels. We continue to increase our understanding of promising practices. These are all important for being able to communicate through words and stories, frameworks, etc., to donors and government structures and other decision makers. One of our first lessons learned from the beginning of the Global Social Service Workforce Strengthening Initiatives was the need to have evidence in order to influence decision-making about social services. Evidence both at the policy and practice levels, and especially for initiatives aimed at increasing investments in human and financial resources. Today we have heard about the different approaches being taken to build the evidence. I, along with many of you and others at the different country levels, have made important gains in building the evidence base through mapping studies that include interviews, observations, analysis of reports, data, and other research. Different stakeholders have shared with us very important and evolving methods for building our data. Research is important to realize data-driven decision-making. This means moving data to results, and this requires advocacy and influence. This is the action part of the evidence base. But in order to see that operate in practice as a community of advocates for strengthening social services globally, we need to get better at getting the message across to a wide variety of audiences. And I think the experience we just went through is part of that. How do we get better at this? We need to get better at telling stories that provide data, promising practices, impact, challenges, and investments needed that those in different audiences listen to and hear in a way they can understand or are willing to understand. As we embark on increased efforts to influence decisions around investing human and financial resources in the social services workforce, evidence for action requires not only explaining the what, but also explaining the how. How do we translate the data into messages that are understood by different audiences? And I think this experience that we've just gone through shows the difficulty in that. Lessons learned from local experiences at what works and doesn't work are critical for building our toolboxes with evidence for action strategies. We also need to work at not only aligning our priorities with donor interest, but also influencing donor interest and priorities. As has been pointed out, where does social service workforce strengthening sit in philanthropic discussions? I was reading an article that I sent to our secretariat. I was reading an article sent to me by a former communications professional with UNICEF on storytelling and evidence-based policy. The author, Brett Davidson with Open Society Institute, suggests that we need to be able to talk to funders, government officials, media, other organizations, and the general public, which we have just been discussing now. But also, he suggests we need to be able to talk to our constituencies. So I looked that up, and a constituency is a body of customers or supporters belonging to a group. So I take that to mean all of us, as we all have needed or will need to access social services at some point in our lives. And I think we sometimes lose touch with that. How do we talk to people? What do we say, and how do we say it? We grow up learning that storytelling is entertaining and educational, but there's much more to that. One thing this article outlined in terms of looking at stories is there are three main functions. Stories can organize, stories can help mobilize people around an issue. Advocate, stories can act as a powerful persuasive tool. And educate, stories can help people better understand an issue and enable informed dialogue. As a community, the challenge is how can we be better at telling stories, getting our messages across, different messages to different audiences. This is the action part. The planning for today and reading this article challenged me to explore some of the resources from the field of communication. I said we need to know what our Nicole Browns know and others who are in the communications field. One suggestion was to employ the use of metaphors to get your message across. Metaphors use an object or concrete representation of something that's more abstract. One example was to provide a fresh common language for exploring the impact of media. How can we know we are making a difference? And this is from the field of media. There is a very interesting metaphor that's used in media it's called activevoice.net. And it uses horticulture as the metaphor for media and telling stories. You know what I mean when I say horticulture? It's gardening. And so it uses the different tools. And I found it quite fascinating. For example, rakes. You know, the rake is rakes are stories that scratch the surface of an issue to engage people with different perspectives around common values. Sprinklers. Sprinklers facilitate new growth from a wide array of storytellers, not just a single creator. Wheelbarrows. Wheelbarrows transport audiences through a strong narrative structure, but refrain from offering simple solutions. There are others in this, but it's really quite fascinating and made me really think about, as we were going through this today, okay, where are our metaphors? What is the common language we can use to get the stories across about the impact we have? And I think that's the challenge we have, is what's the words, what's the language that we can use? And in this workshop I was in with this particular communication specialist from UNICEF, she kept challenging us, okay, what do you mean by protection? What do you mean by professional? What is, and so you begin to dig down. So that's the message I want to leave. It's really how do we begin to find those metaphors that we can use that other people will understand. Thank you for being here, and I think there's a lot to look forward to in the future.
Thank you everyone for coming today. Just as a reminder, I'll grab some Post-it notes, so if you're interested in finalizing the key messages, please share your inputs. We look forward to seeing you all soon. The full recording of today's symposium will be available, so if you'd like to share it with colleagues, you'll get a link to that so you can share it as well. Thank you everyone, and for our steering committee members, just hang back over here and we'll help you to get access to the other building, which is tricky. So thank you everyone, safe travels back. Thank you.